I'm gone, no more lying. I'm gone, I'm searching for you. I've got you in my heart, in my heart. There won't be anything to tear us apart, tear us apart. So baby, tell me now, tell me now. I wanna love you some way or somehow, because your smile makes my day, and you take my pain away. Oh my darling, love me back, 'cause I'm gone, no more trying. I'm gone, I'm waiting for you, 'cause I'm gone, no more lying. I'm gone, I'm searching for you, 'cause I'm gone, no more trying. I'm gone, I'm waiting for you, 'cause I'm gone, no more lying. I'm gone, I'm searching for you.
Oh, sinja uli di sombranzelten meg, et zu te saluda, antes Dio hum niga. Radzauds and malakes fredzas, durante todo em memu. A nogi distancia, gumugupugi palu. Zangiman malak guafi, ikonung nasugi airi, prebatu la noci, nai banderata gaigi, pues atan fanny bandera, kau esta pagua pumalapa, giluk tanu man libri, sentami ti man ko badi.
songs, the word they like is ODA. To the weekend escalate. Seems like we already determined in our fate. Jesse, yeah. Oh no, no. Love season is in progress. But don't stress. Love like a burn is on fire. But you understand is gonna take you higher. So now watch I say, love season is in progress. But don't stress. Love like a burn is on fire. But you understand is gonna take you higher. So now watch I say, go ahead and relax, baby. It's time to take it slow. It's time to wind down and let you have. And all my eyes to you is there. But I'm talking about pushing love and rhyming time. The sheets is mercy, baby. All up on the bed, the floor, the porch. I even by the back, by the front door. Yes, yeah. Cold outside, I'm feeling fire. The wind gets so hungry, girl. I'm going down, 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 yeah. The body keep it ticking all the time. The shit up to the punch, I'm not in control. If I don't turn, I'm without you, yeah. Love. it's on the sunlight to see. Yeah. Oh, yeah. The season is in progress. The dawn dance. Love like a burn is on fire. Natural is time until I take it higher. So now I just say, the season is in progress. The dawn dance. Love like a burn is on fire. Natural is time until I take it higher. So now I just say, yes. All right. This one dedicates all the goddamn. Well, I met this girl from the country. She wants to know everything that's about me. I am single. What is your age? She kinda hesitate 'cause everybody plays the game. Well, I be to you what's so surprising. Was a stranger in your town, you walk by me. Can we just walk? Let's have a talk. 1 minute and you will see. Oh, I can tell by your eyes. Swing my way. It's a love that's for real, Miss Lady. Come on, wine with me. Now, baby, now she knows I got her remedy. The real thing, not only physically. I need a lifetime lover. That's a lifetime lover. Now it's getting kinda serious. Don't be scared, don't be delirious. I need a lifetime lover. That's a lifetime lover, yeah. That's my remix is on. Oh, no, 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 yeah. Oh, no, 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 yeah, yeah. Hey. So. Oh, no, 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 yeah. Oh, no, 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 yeah, yeah. Hey. So incredible. Well, how we play. I'm for you and my heart. Girl, I had yours. No room to complicate. Just my appreciation for you. And girl, I love the way your body fits mine. Just a daily dose of your love. I need the most. I need your love. Because every morning, every day and night we argue, girl. Even though we always fuss and fight, you still mean the world to me. Let's try to fix the problems, 'cause we're falling apart. I'ma love you over again, like I loved you first time. Yeah. Small kind lovers rock, high rise origination, marination right here. For all the lovers out there. Na, 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 na. Yeah.
Good morning, Guam. Good morning. Welcome back, Sabrina.
Thank you.
Good morning. Morning, Jason.
Yeah, I'm here too.
Right on. Yeah, hi, Jason.
I'm just chopped liver on the side,
Yes.
so I'm cool.
Good morning, Link Fam.
Welcome
Facebook
back,
Live.
Bree. We missed you.
Missed you guys too.
How many Omicrons did you bring with you?
That's cruel.
Oh, no, wait. Let me get. You're coming to the land of Omicron.
Yeah.
Yeah.
Those numbers, though. Oh my goodness.
Yeah. And we had Nestor when you were out interviewed Dr. Berg, and he was saying like they were expecting, and the high end he said was like 600, right? Yeah.
Yeah.
He said that. I remember watching a portion of that interview, and when he said that later on that night, the numbers were like 500 or something like that.
Yeah.
Last night, 850.
Yeah, that's a lot.
850.
What about the hospitalizations?
Up
Because that's the one that really is kind of
36.
scary. Whoa.
Yeah, so it's been hovering around, like 20, 22, then,
Yeah,
then 25.
it kind of
and-
jumped last week, right?
And then over the weekend it went up to 34, and
Right,
this morning it's 36. So
And that's the metric that apparently they're watching. I'll just say with Dr. Hoa and pretty much everyone we've had on is they say, I mean, if you're getting 800 or over 500, 600 positives every night, then there's just a guarantee that some of those people are going to end up in the hospital. So that's what they're watching. Some interesting news we got coming up in the news, but apparently the governor is in Washington, D.C., and this according to Dr. Nathaniel Berg, who is the chairman of the Physician Advisory Group. He
Did
told
she
her,
leave?
I don't know. Oh, yeah. He said Governor Lulian Guerrero is in Washington to ensure that Guam gets its fair share of test kits. And that was about all we got on that. I don't know. There wasn't an announcement. Usually they would announce like, hey, the governor's going to Washington, D.C. to do this or do that. So I don't know if it was a personal trip or how she's going to go there and ask for more test kits. I don't know. We'll ask though. We'll put out the ask.
and that's kind of like the other news that Dr. Berg was discussing with us yesterday, because Daniel actually got him on an extended interview. We're going to play that later on the show. But
All right.
also now officially, I guess officially, is it beta test? Would you consider the OCA site now? He said that's administered by Guam Radiology
Yeah.
Consultants, which is Dr. Berg's company.
But they're doing it with public health tests.
Yeah.
And so he's getting like an allotment of test kits from public health. And at that Guam Radiology testing site, they are testing everyone.
Oh, I thought they were testing people before.
They were testing, yeah. So I don't know where they were testing them at, but according to Daniel in this story, they're now officially open across Oka. Pele?
Yeah, so like that clearing, like where
is that where they were?
sometimes
Yeah.
they have like church revivals
Right,
there and everything,
yeah,
like
yeah.
right across from
I
Payless.
see.
Yeah.
Yeah, so it's not you have that big
so
the
it's
Guam
not in-
Radiology Center, the Guam I think
Right.
it's called the Guam Health Center.
Yeah, so they were testing it there, and all the medical clinics in that building were complaining because the people showing up to get tested.
Yeah.
And it was crazy, like the pictures we were getting.
Yeah.
Wow.
And if you know about, I mean, I used to take my dad there, and the parking lot is massive anyway.
Yeah.
I mean, but they said parking was
Well,
an
it
issue.
fills
I mean,
up
you
on
could
a
fit,
regular-
like 300 cars there.
Yeah. But on a regular day, it's usually pretty full, right?
Yeah.
So what is the change? I understand there's a change in the
Yeah.
testing strategy.
Well, Bree, thank you for asking. The change in the
Okay.
testing strategy, unless you're Dr. Berg, is that they're testing symptomatic patients only and high-risk close contacts, which are defined as anyone 65 or older,
I see.
the unvaccinated,
Yeah.
those not fully vaccinated,
Or if you live in the immunocompromised environment.
if you're immunocompromised,
Basically,
and if you have the comorbidities.
do you have your own do you have access to your own dedicated bathroom or not?
But that's
the
for
major
isolation, yeah. And so that's what they did. It was kind of like a crazy pivot, Bree, because when the surge kind of started, the governor was like, test, track, and treat. And so people really want to go get tested because they want to know, you know what I mean?
Oh
Especially
yeah,
if-
you missed that. So we had the 3 W's and now we got the 3 T's too.
yeah, there's 3 T's now, but not really tests because they're doing it limited. And it's all because of shortage of test kits, I guess.
And that's a nationwide shortage.
That's what they said, but then I'm not sure because if the governor's going to D.C., what's she going to do? Bring back test kits in her suitcase?
Okay, so for those of you wondering about the testing, that's the other big thing that happened, Brie. I'm sure you know that, but like now you actually need an appointment if you are to be tested. We've been on top of this for at least like the last week. I'm looking at the Eventbrite page, which is tinyurl.com/COVID-stops-with-me. Today, Friday, and Saturday booked solid for the testing site, but the
Sold out!
But the aforementioned site at Oka.
Can you book tickets for that?
No, that's not, that. We were talking about that. That's not on the system. I wonder if it will be. Hopefully, but the Oka site is open from 7:30 a.m. till 2 in the afternoon, Mondays through Friday. But Dr. Berg did tell Daniel Perez yesterday they're looking at possibly extending hours of operation. Given the supply of testing.
That's so interesting to me because the whole reason why they're testing, limiting the testing to symptomatic patients is because they said that there's a shortage of test kits. But now that Dr. Berg is doing the testing, apparently, I don't know what happened to the shortage because he's just testing everybody.
So just for clarification, the testing that Guam Radiology is doing, Is that a drive-through, or you have to get out of your car?
No, you line
and
up.
You
Yeah.
line
Yeah.
up.
It's a lineup, and then you go nuts to butts with the people in front of you. It's great. I mean, yeah. If you look at do we have the pictures, sir? I have them. Oh, he
And
has
again,
them.
it's only for symptomatic
No.
people.
It's symptomatic.
Guam
and
Radiology
asymptomatic.
is everybody.
I see.
Bring the dog.
Yeah. Okay. So if I
So
can,
the testing strategy does not apply to Guam Radiology.
Yeah, I don't know why.
if I can quote from Daniel's story right here, since the Teason site is only taking in those who are symptomatic and high risk, Daniel said last night, Dr. Berg assures residents that the one run by Guam Radiology Consultants will accept both symptomatic and asymptomatic patients.
And by appointment only.
I don't know if it said that because that one's been crazy busy, like for at least like the last week, at least.
And the reason why they changed the testing strategy is because there is a shortage of tests.
Yeah.
Yeah.
All right. Okay.
And this just came down. Was that Tuesday, Chris?
I want to say Monday.
Yeah, or was it Monday?
Yeah, Monday. We did have.
Yeah, so policy change was last Monday. Then they said you need to make an appointment. So that's been going on for like what 9 days now, 9 work days.
Yeah.
And then just this week they said, okay, well, supplies are short, so now we're gonna prioritize, like
Yeah,
people
but then
are
now-
most vulnerable.
Now Dr. Berg is saying, I'll test you guys over here at Guam Radiology.
And how many tests are they conducting? And are they factored into the JIC report?
That's
or
a
is that separate?
fantastic question. We've missed you so much. You always
Yeah.
right on point.
Well,
right
we'll
on.
get public health right on.
Yeah.
They're going to.
The other thing, former Senator Fernando Esteves is now the incident commander.
Right, I saw him in one
Yeah.
of the press
And
conferences.
he actually
I
said
was
that
wondering
of
what
course
was he
the
doing?
daily volume, I guess, what the Teason site normally does. They said they always plan to handle about 600 per day, but they said they were going way over that, like
Yeah.
for at least a week.
Well, yeah, because we're in a surge.
Yeah.
What about the unvaxxed
Yeah, it's still.
division? Can unvaxxed eat indoors now? or
Unvaxxed
is
cannot
it-
enter the premises unless it's for takeout. But
So it's still in
what is it
place?
now, Jay? They can dine outdoors.
Yeah.
They increased the
You can
outdoor
do the
dining.
alfresco thing.
Yeah.
But,
Hey, keep it positive. You're not being
yeah.
targeted. It's just alfresco.
What about any more results from
They got a batch of
the
results
CDC?
back from Hawaii.
Yes.
Now they're sending them to Hawaii. They sent off
It was
10
a batch
samples.
of 9 samples.
Okay. 7 was
that
Omicron.
covered December 16th through the 27th, so basically right through Christmas. 7 of them tested positive for Omicron.
Oh, so we had Omicron before Christmas, before
Yeah, and then the
We
other two were
lifted
Delta.
everything. I see.
Yeah.
Okay.
So welcome to that part of the show where we get Bree up to speed in like 5 minutes.
Are you good? Anything else?
Yeah, no, I'm good. And I have to say, when I arrived, good job to Public Health and Guam
How was it?
Customs.
Right on.
Actually, I did everything online, with the QR code, and it was pretty smooth going through. I was kind of nervous, like, oh man, please, I hope the QR codes work. Because the last time the custom QR code wasn't working, but they seem to have fixed whatever issues they were having and came right through. I mean, there was a little bit of a wait,
Yeah.
but everything
What
was
is the
working, so-
protocol for you? You're coming from America, right?
Yeah, I was coming from Vegas. And yeah, I was even confused just going on to Public Health's website. I wasn't sure, do I need to get a test or...
Yeah, Bree was messaging me and she goes, "Hey,
not.
do I need to have like a test?" And I was like, "I think so." And then she called me a name that you would normally like reserve for like a female dog.
I mean, what? You think you need a test to get in there? It's not like we're in a surge or anything. Come on.
But since
Yeah.
since you've been gone, and I'm not quoting Kelly Clarkson now. Yeah, I've been tested twice more.
Oh, wow.
Joser's wife actually, I got home test kits from there was a point when you were gone, when you were in Vegas, where local pharmacies actually had
The home test kits?
like minor supplies of home test kits.
Yeah.
But like I know a lot of people that got them. I did it twice. By the grace of God, both times I tested negative. But that's a real limited commodity now.
Yeah, it was hard to find home test kits in Vegas because there was a point when I was kind of feeling not so great.
Yeah.
But then I was fine the next day. But I really wanted to go and stock up on home test kits and send some home.
You're going to bring some back, right?
Right. And I couldn't find any.
Wow.
But then I ordered some,
The federal.
yeah, for my mom. And
Did you check at Trader Joe's?
I didn't even get a chance to go to Trader Joe's. Sorry.
I know. I got you.
It's like Trader Joe's KN95 mask with organic peanut butter.
6:32. The show is proudly presented by.
We're glad to have you back, Bree.
Yeah, we
really
are,
missed
definitely,
you.
Bree.
And and may I just say,
yes.
the overwhelming amount of support
Yeah.
and sympathy
Yes.
and condolences
The
and love. I
Admiral
mean, we
came
tried
on.
to share as many with you as we could, but there were so many people who really wanted to let you know that they were thinking of you and praying for your family.
Yeah, so we had the Admiral on, and the first thing he said right out the interview was that he wanted to extend condolences to you and your family from JRM and him and his family.
Oh, thank you, everybody, for your support.
6:33. We're brought to you by
Wait,
Pacific
I still
Points.
had some more questions.
Yeah,
though.
no,
I'm
yes.
Sorry. Why?
Can I
did
just say who
the-
we're sponsored
yes,
by?
of course.
Yeah,
go ahead.
Pacific Points, Cabo Enterprises, ITN, and Jack in the Box. Yes, Sabrina.
By the way, Pacific Points, where we got these awesome duck face masks.
duck face.
Okay, the
Yep.
one that Bree is wearing, I was
It's
like,
a
oh, by the
thing.
way,
Whack.
you were wearing the 3M one, right? And I was like,
Yeah.
Bree, I tried doing that, but like it felt like I had braces because we're projecting all show. I was like, try this duck face one. I got a bunch of these. How do you like this?
It's really huge, I think,
Yeah.
but I'm able to like speak. And the other ones, it kind of muffles you. But this even seems like I have to talk really close to the mic, and the whole duck part kind of prevents me from getting right up on the microphone, the way that Chris likes me to be,
Yeah.
so you could hear me.
Yeah.
But I wanted to ask about the MAB treatments and the clinic in
Oh,
Mingy
yeah, I
Law.
know
So
this
Yeah,
one.
that-
I
it's
know,
closed.
I know this one. Teacher, I know. Miss, I know. Yeah, it's closed.
And why is it closed?
They ran out of Regen Cove.
Oh, teacher, can I get extra credit?
Wow.
Yeah, extra credit.
GMH is also closed.
Yeah.
Or GMH also suspended
There's
the.
there's no monoclonal antibody treatments. What they do have though is they have the COVID. There's like a
The
COVID
pill?
COVID treatment pill. But what I heard, okay, just between us, is I heard that it was in a refrigerator at GMH, and that the doctors in the clinics have been treating high risk, close contact patients and positives, but they have not been able to get the treatment from GMH because there were only like 80 pills. Yeah, and so they're trying to get more, I guess, but that's the situation. Because I had a couple doctors from the clinics call me and they asked me, "Hey, can you talk about this? Because we're trying to get these pills, but it's the process, and so I don't know, how do you divide 80 pills?"
And who gets them?
Yeah, yep. I don't know if it's like maybe how many Lou and Josh bumper stickers you got. They bump you up in the line. I don't know. But that's actually what
You
someone.
can exchange the pin.
Yeah, maybe exchange your
Oh,
pin for
did you hear about the pin? That's another thing.
What pin?
the COVID pins
There, there's COVID pins.
What do we need COVID pins for?
for the people who worked from home in the COVID. No, it's for the front. Okay, so this whole thing where some government and Guam employees were getting these COVID-19 pins. And it was to thank them for their service during the pandemic, which we're still in, by the way. And they all got these pins, and then so some government employees got them, and I think it started with like DYA, and then GPD was like, "Hey, what about our pins?" And then GPD got them, and then Guam Memorial Hospital was like, "Hey, what about us?" And then they went and they got all these little COVID-19 commemorative.
Is this a
And then a
national
buttload of
COVID
comments were asking about what
pin,
about
or-
it's
teachers?
local.
What about teachers? What about security guards?
Yeah.
What
Who paid
about
for these? ARPA money? Or
we paid for it.
ARP money? paid
Local
for COVID
funds.
pins?
No, it was like local funds. Never really got a straight answer.
How much did we pay for COVID pins?
I'm finding out, Bree. I'm sorry.
You gotta be kidding me.
Yeah. No. Yeah. And so
Surprise!
yeah, they got the pins, and they got a nice letter from Lou and Josh, and I was like, "Thank you so much."
And to his credit, Chris has been petitioning for the local media to get pins too.
I have
And,
not
and
just
I just jumped in with that.
Hello.
I was like, I don't need a
Okay.
pin. I'll take a check though.
It wasn't just the local. I was saying all the essential workers, right, in the private sector, because we're over here looking at the Gulf of Guam like, "Hey, we were working too." Not, I mean, us, but gas station, grocery store, all the people who worked during this pandemic.
So
Yeah.
what about premium pay?
Then there's no premium pay. Ha 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 ha.
Any stimulus? Any additional?
Sorry.
Mayor
No.
Jesse Alec, every time,
Yeah,
every,
yeah, did
every
the
time
mayors get their
when he
money?
would come on, he would always say,
Okay.
if Sabrina was here, I know what she'd ask. Nothing's changed.
Mayors, I know this one.
No way.
Mayors, they were. It was announced they were getting 17 million,
Mm-hmm.
right? And then they just got the 8 million of
So
the
they did
17,
get-
but they got it a couple weeks after the announcement because they had to come up with a spend plan. And so they did that, and then they got the 8 million. But he was saying like a lot of it's going to go to village road projects, and then also to prior year obligations.
Village road projects.
Yeah.
So what about the Biden
That didn't
infrastructure
pass.
package? No,
Wait,
there's
that
the
one-
infrastructure
yeah,
bill.
yeah.
That's supposed to go to like roads and
Yeah.
infrastructure, right?
There's a lot of money.
Did we get that money yet?
Did we get that money yet? It's possible. There's a lot of money.
Right in the comments, Kiana is saying GDOE didn't get pins.
Yeah, they didn't get pins, and neither
That's
did
that's a big batch of pins they got to make for the largest agency
Bree,
in the government of Guam.
even the mayor's council, the staff didn't get the pins.
Oh
Yeah.
man.
And that's
You
the
know
thing.
how I
It's
feel
like, you
about
know,
the mayors.
yeah, that's unfortunate.
Yeah,
you-
Bree rides. She rides hard for the mayors and everything like that.
Yeah.
Obviously, seeing their staff out each and every day, because then they never really used it as a rallying cry, but they're like, we never stayed home. We went out every day. We came into the office. We hit the roads. We saw people. We saw villagers. We tirelessly, worked.
yeah. Good morning.
So just
There's
quickly,
after-school vaccinations too.
the RegenCove, we ran out of RegenCove.
Yeah.
We're getting more.
They're expected.
Yeah. But you see, the thing is, Bree, the RegenCove, it doesn't really work against the Omicron.
Yeah.
I see. So what does?
The pill,
So just the pill.
the 80 pills that we have.
Did they?
Maybe
order
they're going to
more
cut them
pills?
up in half or cut them in
Is there a
thirds.
shortage, a national?
There's a
shortage of
demand, a
pills?
high demand.
I see.
Yeah. Maybe the governor is going to get some pills when she's out there too. Anyway, I did ask the communications director of the office of the governor, Crystal Pacos and Augustine, the purpose of the governor's D.C. trip and who accompanied her. Traditionally they would announce stuff like this. I mean, I'm kind of getting used to it, but it's just how it is. The protocol of it. There would usually be some type of release that, hey, the governor is going off to D.C. to meet with this person or that person and that person. So it is kind of like, I don't know what the word is, but it's just surprising, when you find out, oh, the governor's off island.
No,
Oh.
but there's that notification, right? That goes to.
Yeah, but they don't send that to the media.
Well, did the speaker know that
I don't
she's
know.
acting lieutenant governor?
I had her on yesterday. I forgot.
went off
There was
yesterday.
just so much to talk about.
She went off. Oh my goodness, the interview with Joint Region
Yeah.
Marianas.
Yeah, so
What's going on with this health campus? So it's Eaglesfield, not Eaglesfield,
Yeah, it doesn't sound like it's going to be Eaglesfield.
and it's not going to original landowners either.
Hold on, I'm sorry. We just have some funny ass comments in here. Mark Santos comments. Sabrina is checking if Chris and Jason took good notes. Glenn commented here. Sabrina's catching up with the class this morning. And then with this guy here, Joseph Anthony Charleff comments. The smart one is back.
You're not wrong.
Yeah.
You're not wrong.
Birth control.
Yeah, I was when we say the pill works, not the pill.
Yeah.
It's the other pill.
But send some of those bills too while you're at it.
Okay. Also,
No,
Bree-
man, this is a
also,
lot of
Bree-
stuff that happened and didn't happen while I was gone.
Yeah.
Also, Bree, there's after-school vaccination clinics now. By the way, everybody, if you need to get any Guamanian ages 5 and up, today it's going to be in Sinania at CL Taito Elementary School from 3 to 6 in the afternoon. If you want to get the Johnson & Johnson or the Moderna or the Pfizer, please head over to CL Taito. That's from 3 to 6. Anybody 5 and up, you can get your shot.
Right.
And school's still in session. Public
Yes.
schools, they're still
Not
'cause I saw
private, as I'm sure you know.
Yeah,
'cause
yeah. My
Brock's home.
son's tell.
Yeah,
tell
because the
a-
public
what is
school
it,
kids are
remote.
expendable. That's just for the So no, what it is John Fernandez was on yesterday,
Yeah.
and basically public health is acting like we're not in a. I mean, he was saying as long as public health is not ramping it up, like, oh my God, the sky is falling, then GDOE is not really justified to close. And then what he did say is that they're looking more at closures due to like staffing issues because they are having Bree. It didn't really hit me until after the interview, but he was saying yesterday, I think yesterday morning, they had about 40 to 50 staff from Central detailed out to the schools to fill in shortages. And then he had said the week before there was a day where it was like 80 some. And so I actually know a couple central office admin staff who do things, specialized things, like, vision testing or speech therapy or whatever. And they're supposed to be doing those things at the central office. But now that there's all these shortages, they're being detailed out to the schools to plug all the gaps. So what John had said was that if we do see any type of school closure or migration back to online, it would be at these, not for the whole district, but piecemeal at certain schools that are struggling with staffing issues or, I guess even high case counts would be an option. But the counts coming out from GDOE, I mean, it is like whoa.
Yeah, well, in Vegas, it was all over the radio that, and this was a couple weeks ago, when they started seeing a lot of staff at the school systems getting sick.
Yeah.
They took a 1 week pause.
Yeah.
And no school, no nothing, just so everybody could get well,
Right,
and
yeah.
probably not like spread it.
That
in the
kind of
school
makes
I'm
sense.
sure. I'm
And
sure
I
you're
think
well
that's-
aware
So
of
there
this.
was a 1 week pause there.
Oh, I was gonna say, I'm sure you're well aware of this because your son is, of course, in private school and everything. But Father Val came on and said that they had a marathon meeting leading up to the decision to migrate all of the Catholic schools to virtual learning. He goes, that was not an easy decision, but we
They
felt
said there was even some disagreement.
yeah, ultimately it was the best one. And then he even said, we've been getting, some flack from parents
Right.
and whatnot. But he said they started this Monday. They're going to go and reevaluate on about February 7th.
Right.
And then figure out what the situation is, assess everything, and then determine how to move forward.
But what
from
he
there.
said, Bree, was that it was kind of like exactly what you said. He said that there's no evidence that it's being spread at the school, but that the community numbers are so alarming that he felt that as as the father kind of the school system, that it was just the responsible thing. I totally agree with it. And in fact, I think that, parents having to send their kids to school, 850, all these positives, it's frustrating. It's because if this was Delta, we would be shut down, right? And that's kind of what also, Bree, they're asking of everyone, and it's kind of a hard sell to me, is they're trying to just adjust everyone's mindset to adjust to the new normal, which is this,
That's a new phrase,
That's
too.
a new
Bree.
phrase. That's my new phrase, guys. Can we get the T-shirts? The Lou Normal.
Lou Normal.
Lunar.
He's been rocking that one for like the past couple of days now.
It's been a couple days.
That was clever.
Thank you, Jay.
Yeah.
And so we just got all these positives, and I know parents are freaking out, but it is interesting, and just talking to people at the schools is you get a classroom where you have a couple kids who are positive, and then you got like 7, 8 kids who are out because they're close contacts. And then remember the protocol, if you're not vaccinated, there's differing protocols about if you come into contact with somebody who is COVID positive, right?
Yeah.
And I know Jay has that.
Could I jump in with the
So
food
that
commodities thing?
I hear at the schools there's like classrooms where it's like empty or there's just a couple kids,
Yeah.
and they're being taught by someone from Central.
But they also said that one of the big decisions, because almost universally teachers have really opposed, and they said, we would rather either be full on in the classroom or doing virtual, because
Right.
doing like the hybrid format, they said it's unbelievably difficult to do that.
Right. Yeah. And so that's where we're at. John Fernandez kind of saying that don't anticipate a school-wide pause or anything like that, but if there are going to be any shutdowns, it would be targeted specifically at different schools.
And also, Bree, I'm sure you've seen this, but Dave Delgado, our sports director, has been on the school leagues, the interscholastic school leagues.
Yeah, they paused.
Suspended all play for at
Right.
least a week, because they just said, the spread is too much. And again, they're going to reassess.
But you still
what the
got to go to
situation-
school.
Yeah. We're going to figure out what the situation is like in a week, and then
Right. Yeah.
if I can, Chris, just let me
yes.
jump in here. Food commodities, because this is a little time sensitive, you guys. Link fam, if you're listening right now and you are in the village of Asan Maina, there will be drive-through food commodities distribution today from 9 to 4 at your village mayor's office for Asan Maina constituents only. There are 350 such bags, so if you or your family is in need of food commodities, please head over to the mayor's office. Again, that's from 9 a.m. to 4 in the afternoon. Also in Petey, Mayor Jesse Alex Village, food commodity distribution begins at 9:30. However, in Petey, they're doing door-to-door distribution. There are 150 such bags, so they're gonna go to the villagers' home. So again, Asan Maina today, 9 a.m. to 4 p.m. Drive-through distribution. Also today in Petey, door-to-door distribution begins at 9:30. Tomorrow, the island's most populous village, Dedido, right up the street from us at the Guam Football Association field, there are 1,000 food commodities packages. That's going to happen from 8:30 in the morning till 11:30 in the morning. Please, Dedido villagers only.
Yeah, we've been very lucky here at the station, Bree, because I know a lot of workplaces are really struggling with, again, not just positives, but people who come into contact and then have to like isolate or quarantine. Like we did the shoot at Ruby Tuesday yesterday. Oh, you missed out. It was awesome.
Steakhouse specials.
Yeah, they had the Steakhouse Sensations. They had to close from Tuesday last week to Sunday.
I saw that.
Yeah, and so we're seeing that around a lot. Also, we got a couple teachers in here. Kiana, district-wide GDOA schools have a lot of staff and faculty out. It's crazy. Almost daily, I have a lot of students that are absent as well. F. Glenn Lujan says we are being detailed. We're being deployed to assist with supervision and covering classes at schools. Bree, also, while you were out, there was a big fat raise they gave to. It was really interesting, man. I wish you were here. So remember all the studies they did where Guam Police Department officers were like so underpaid,
Right.
And
we have police were making more. Yeah.
We have the chief on when he was coming on all the time, and he was saying that he's losing officers to like not just the feds, but to local,
Right.
like the port,
Yeah.
right, or the airport, because they all just get paid so much more than GPD. So instead of raising the pay for GPD, which would have made them whole and put them on a level with everyone else, what they did was they gave an 18% increase to all law enforcement officers, to include like Rev Tax has law enforcement officers.
Right.
Yeah.
Tax
So
enforcement. Mhm.
yeah. So anybody who is law enforcement or is like quasi law enforcement. I mean, they had
So
people,
who exactly does this cover? Obviously, police, firefighters,
Right.
marshals, port police,
Yeah. Airport police.
airport police, customs,
Yeah.
right?
DYA,
Tax enforcement, like Bree just
DYA,
said.
tax
DYA,
enforcement. Yeah. So everybody it's a great tactic for election year.
So everybody got a raise.
Everybody in
so,
law enforcement.
Oh wow! It's already in effect.
It's in effect it's going into effect January, a couple days, few days. Wow. Yeah. So we had.
It doesn't do anything at all then to make it fair, right? So
Well, all it is if GPD is down here and everybody else was up here already,
They're
and you
all going.
raise GPD up, everyone else went up too.
Yeah,
It's
so
a-
it's-
a
So
minor-
Proportionally, they just
Yeah. So they still
it
are
was a
actually
scaled pay relief.
Yeah, they're still
grade.
underpaid. I mean, problem not solved. But
And
Welcome to our new segment, So That
reasoning?
Happened.
What was the reasoning?
Because
for
they
that?
did that competitive wage thing. Remember they did a study, and then the nurses got their raise last year, and then law enforcement. And guess what? John Fernandez was on, and he said the teachers are next. Okay.
So there was a competitive wage study that showed that the responsibilities of police officers isn't as important or impactful or as like airport police and port police. And no disrespect.
No,
I'm
no,
just
no.
trying to understand.
No, I believe what the study showed was that GPD was underpaid.
Right. Yeah.
Yeah.
We know that.
Yeah.
But I'm just saying, why did everybody get an 18%?
Well, because the more the merrier. The more people you give a raise to, the more people want to vote for you. That's election year, Bree. I mean, they kicked it off like no shame, straight up January. First month of the election. And then the teachers are in line next. It is what it is, though. You know what I mean? I just feel for, because the whole point of that was supposed to be to allow Guam Police Department to retain their officers, right? Because they get paid a little more. And now it just seems like they're, I mean, baseline, I guess they would see some kind of increase because
And so, what about help for the private sector? Is it or the private sector?
They got
getting
the
any kind
LEAP.
of- Yeah. Oh, the leap.
Yeah,
I
the
see.
leap. And then I think what I'm hearing is that they may be trying to gear up to get some other type of assistance because if they got the leap for Delta, right, and we were kind of like open with Omicron, we're seeing some of these closures that are being forced by the quarantine isolation and the positives. And so we're getting Mary Rhodes on tomorrow. That's just what I'm feeling like. I'm feeling because remember they wanted, they got the 50 mil, but they wanted more. And so that's where we're at. Yeah, we didn't get a pin.
Two really good comments from F. Glenn Lujan. First of all, saying having Sabrina back is a sweet sensation for Guam. So hi, Ninny Poodles, Debris. And then also saying, a day, Bree's got a big makeup assignment.
Ooh. What else, Bree? Come on, I feel like I really took a lot of notes.
Nah, I think I'm good.
You're good?
Yeah.
Okay.
For now.
For
Kinda
now. Well, just
press,
listen along
press.
and
There's,
yeah.
Isn't there a press conference today? We doing press conferences? No. Public Health still doing their weekly briefings.
They
Public
did.
Health has
They actually
theirs.
just did one. I think they did one earlier this week to kind of announce the change.
In testing format.
Yeah, the change in testing format. Unless you're the head of the Physicians Advisory Group, apparently there's no test kit shortage for Dr. Berg. But I did ask Janella and the director, Art St. Augustine, the director of public health, if that testing, limited testing, applies to Guam Radiology, because it's such a conflicting message when you have the public health authority saying this is what we are going to do. We are only going to test symptomatic patients. And then you have this doctor who's the number one advisor to the governor saying, oh, no, at my clinic, we're going to test everybody. We got you. Don't worry. You know what I mean? It's very confusing. Who's the boss? You know what I mean? So it is what it is, though. I mean, if you guys got to get tested and you just want to know your status, and we always bring up this example, Bree, of this man whose son was positive. He didn't have any symptoms. He went to get tested. But under this new protocol, he would not be able to get tested at public health. He would have to go over
To radiology.
to radiology
Or your private.
or your private clinic,
Private.
right? Yeah. So.
You know what's going to be crazy in about
And
what?
go ahead.
Oh, please.
So again, so if I'm feeling sick and I'm a close contact, I'm boosted, fully vaccinated, I
Go to
stay
work.
home or I go.
Where's the thing,
Okay,
Jay? Where's
got it.
the?
Go to
Oh, the other thing you missed. There
Yeah.
was a flow chart that came out.
Right.
Oh man,
Woo!
it was like choose your own adventure.
Yeah.
It almost reminded me of Session the other day
It's
when
been
when
updated twice now,
yeah,
I
when
believe.
in Session the other day, I think there was this amendment where they were like, the war claims may come from the general fund, and I think Senator Joanne Brown was like, oh, can we change it to shall? And it really reminded me of that flow chart because it was like, you could, you woulda, or you must, and so it had all these different options. So but they redid it because people were just crapping on it. They're like, what the hell is this nonsense? Yeah, we're gonna find out. I'll find out. So that's the protocol for the testing, guys. I didn't see anything official here. Did you see anything official, Jay, out of public health that says we're not making Dr. Berg stick to the protocols that we came up with?
Not anything official, no.
Is there nothing in public health's release that said, "Oh,
I mean,
Dr. Berg gets
until
an
Daniel
exemption"?
actually filed that report last night about the Guam Radiology Consultants and that organization offering testing. I mean, we've had nothing official said, but again, we've got like a interview that Daniel did with Dr. Berg at his facility yesterday, talking about
Yeah,
that.
we do.
Also talking about in his role as head of the Physicians Advisory Group, what they're doing about trying to replenish the testing supply. And I was also saying, like, since Bree said
They sent the governor. She's on a mission to get more test kits.
when the test kits that hopefully all of us ordered from covidtest.gov,
Yeah.
when they arrive in maybe another week or so, are we supposed to if depending on how we test, negative, positive,
Yeah.
whatever like that, are we supposed to
I think if you
submit
test
the results somewhere?
I think if you test positive, you're supposed to take a confirmatory test. Mm-hmm. But yeah, that is something that's interesting. Is how do we report these positives? You call public health, the line they never answer. Oh, Bree, by the way, while you're gone, they didn't start answering the phones.
They started?
No, they did not.
Oh.
Yeah, we still get a lot of complaints about that, guys.
Joseph Anthony Chargoloff says, Sabrina, then in the first day back, I think you should run for governor. You would make a great governor.
Yeah,
says Joseph.
day.
Bree, if you want to, you got 10 months left. If you want to, Joseph Treasurer.
I heard Congressman St. Nicholas is looking for a running mate, Bree.
Funny. You guys are very funny.
Hey, we're still funny.
Hee hee ha ha.
It's 6:56.
Oh, no, don't go there.
Please, I don't want to go there. Jason Solis from the KUAM news team. We're going to do our first look at news here. Robert, here's who's coming up on the show, guys. Robert Celestial. There is an update with the Radiation Compensation Act. And so we'll get that. It's you guys' chance to get money. Honestly, it's a long time coming, and the eligibility, it's a very wide eligibility, especially for a lot of our older listeners. So you're going to want to listen to that, especially if you've been affected by cancers, and we'll try and get Robert to maybe explain which ones you'd be eligible for some compensation. And there is an update with that as it's winding its way through the United States Congress. So we'll get Robert on shortly. Also, Senator Joanne Brown, this whole war claims thing in the session, that I'm pretty sure she's going to have something to say about this port resolution that came out. We're also getting the lieutenant governor of the CNMI as the drama continues. Of course, you guys know the sitting lieutenant governor, Arnold Palacios, is running against his governor, Governor Ralph Torres. And so we'll catch up with the LT of the CNMI. And also, Jay's got a great interview with WestCare as they've got a new program, Malak Nahani, Bright Futures. And this is a mental health support to Guam's youth ages 11 to 17. Okay, and then guys, remember that mental health conversation. Ask somebody, how is their mental health? Right? I mean, mental health issues affect everybody from beauty queens all the way down to the homeless. So definitely make that ask. Again, it's 647-8833.
Yeah, well, Chris has been doing that all week, guys. You know that, and it's not just we're trying to make good radio, good Facebook, and everything like that. It's the easiest thing to do is ask somebody.
Yeah.
Sometimes they just appreciate that.
Yeah, definitely. 6:58. Jay, let's get into the news now. Brought to you by Pacific Points from the KUAM News Team. Good morning, Jason Solis.
All right, good morning. Robert Celestial, of course, with the Pacific Area Radiation Survivors coming right up in the show. But let's get to your link update headlines brought to you by our friends at Pacific Points. Of course, you can do more and get more with our friends at Pacific Points. And shout out to the whole crew over there working really, really hard throughout the pandemic. So thank you, Pacific Points. 1 in 3, my friends, is a major statistic you need to know this morning as Guam has reached a new record high for single-day positive COVID cases. 850 out of 2,636 samples came back positive on January 25th. That is a test positivity rate of about 33%. So again, 1 out of every 3 people that is testing these days is testing positive. 167 of those 850 tests were reported by the Department of Defense. To date, there have been nearly 30,000 officially reported cases of COVID, with 282 deaths, 6 just this week, and 6,945 of your fellow Guamanians currently in active isolations. Hospitalizations, as we mentioned earlier in the show, has gone up by 2. There are now 36 of your neighbors who have been admitted to hospitals, 20 at the Guam Memorial Hospital in Tamuning, 12 at GRMC up here in Dededo, and 4 over in Agani Heights at Naval Hospital. 3 people are receiving ICU care, with 1 on a ventilator. Of those hospitalized, and there are 36 of them again, 28 are vaccinated, 8 are unvaccinated. Well, of course, we've been talking about that new testing site in Oka, and that is going to lead off our news segments portion of the news, as Public Health's new testing strategy took effect yesterday. And after more than 2 weeks of long lines at the Tidsan test site, that's no longer the case. Daniel Perez files this report from Tamuning.
It was announced on Monday, and it finally came into play. Public Health's new strategy to test those who are symptomatic and high-risk close contacts seems to be working. Public Health PIO Janela Carrera was at the test site today and gave KUAM the latest on the testing situation.
Even starting yesterday, we saw the line kind of start to shorten a little bit, and then today it was a lot smoother. So, I think what it is the community heard our call. They responded very well. They're taking it very well. The business community, local government agencies, the school community as well, and just the community at large. They recognize this need to open up that line to those who really need to get tested, which is, of course, those who are symptomatic, those who meet the criteria for getting tested if they have a work exposure or household exposure, and those are the high-risk close contacts.
As we reported, the Tidsan testing site, as well as the northern and southern community healthcare centers, will be prioritizing residents who need to get tested the most. These include those 65 years and older, unvaccinated or not fully vaccinated, those with multiple comorbidities or underlying health conditions, and those who are moderately to severely immunocompromised. In addition to the Tidsan testing site and its various partners, a brand new testing clinic opened up today run by Dr. Berg.
That site is run by Guam Radiology Consultants, and we're doing that for several reasons. The demand here in the building where we're located grew rather rapidly, and we wanted to be good neighbors to the other healthcare providers in the building who were having difficulty with their patients getting parking. Plus, it was a little more difficult when those who were coming for testing were wrapping around the building. So we looked for another site, and we were able to secure the site across from Ocopeles. That site is easier to organize, and I think easier for people coming in for testing.
Since the Tidsan test site is only taking in those who are symptomatic and high risk, Dr. Berg assures residents that the one run by GRC will accept both symptomatic and asymptomatic patients.
What we're doing is following a policy of community involvement with judicious use of the supplies that are present on the island. And what that is the process is to try and encourage people to think twice before coming to get tested. No one will be turned away, no one. But we're asking people to say, if I was exposed to somebody a week ago and they were positive and I'm not at high risk, and I don't have family members that are high risk, do I really need to get tested? And it's, again, just saying, think a little bit twice because we want to make sure we're not running out of kits.
Dr. Berg added that the test kits being used at the OCA site are provided by Public Health, and they are given an allotment to use for the day. The OCA test site is open from 7:30 a.m. to 2 p.m., Mondays to Fridays, but Dr. Berg said they are looking to expand the time and days. As for the limited supply of test kits on island, Dr. Berg confirmed that more were ordered before the supply thinned out, and added that Governor Lou Leon Guerrero is in Washington to ensure that Guam gets its fair share of test kits. Daniel Perez reporting for Guam's News Network.
And let's stay with healthcare news now, as our island is well into its fourth COVID surge, the Omicron variant has made its presence known, especially with several local businesses. Our Jonah Goncharfis talked to several business owners about how the pandemic has affected their operations.
With the island hitting triple digits in COVID cases for close to 3 weeks now, the impact has been felt by many of the businesses, from staff shortages to completely halting operations. For Andrew Arce, owner of Homeplate, a Kelaguen shop located in the Tomorrow Village, on Monday evening he posted on social media the shop would be temporarily closed due to potential exposure. Also having to cease operations is Subshack, and it's something owner Jonte De Leon has had to do on more than one occasion.
My family, we're all home, we're all quarantining. So our life right now is just kind of like at a standstill. We got to rest, you got to hydrate. So it's definitely feeling the impact at home.
My husband got hit with COVID first. So, because we're in the same household and him and I both have businesses, we've had to close down business on both sides. And then, of course, like almost a week later, I got COVID. So even though we're both vaccinated, it still required, both of us shutting down. I mean, 5 days is still a lot of time when you have 0 employees and, you're your own employee, your own boss, your own accountant, your own runner, your own everything.
De Leon was cleared last week, but her 3-year-old son started to show symptoms and she had to shut down operations yet again.
It affects business a lot because you're just trying to catch up. And then when you catch up, it's like every little sick symptom someone in your family has, it's like you have to shut down because it's the responsible thing to do, and get tested. And even though a lot of places are, you can do appointments now, it's still a process to have to do all of that. And then, now we're waiting, 72 hours sometimes for results.
And for businesses that are affected, the worry starts to sink in.
What are we going to do? So it's definitely a challenge to remain optimistic in this market. We can't open. For one, even though we can't open, we still got all the bills to pay.
It's been what seems like 3 weeks of shutting down business and, there's no relief whatsoever financially. I mean, bills still need to be paid.
With the island still in the pandemic and most recently this surge, both shops have had to make the necessary adjustments to accommodate this ever-evolving virus.
We're marketing it a little differently, because we understand that a lot of people aren't they're we already know what to do, right? Yeah. We don't go out unless we have to. We wear our face masks. And so we're anticipating that. We've definitely seen a big reduction in foot traffic. And so we've taken action in the sense of, working with our delivery partners to be able to try and get more products out there.
By doing things online, like pre-online sales for Subshack, pre-booking appointments down the line for reservations and things like that, it does help. And people are, for the most part, pretty understanding.
Both De Leon and Arce remain hopeful and know it all comes down to just doing their due diligence.
Just trying to find the balance of being able to socialize, but still be careful. So it's a struggle and we're still trying to find that balance. And like we got sick, regardless of us being careful.
I know it's frustrating, especially as a business owner, what's going on with the island. But I guess all I can say is just be patient. This thing, Guam has always been a resilient island. So I'm sure we're going to bounce back from this. So just be patient, be patient, do your part of the job, do your part of the diligence. If you get tested, stay home, quarantine, put it out there, it's not just for you we're trying to look after. We're trying to look after everybody else's family.
Reporting for Guam's News Network, I'm Jonah Goncharfis. Reporting for Guam's News Network, I'm Jonah Goncharfis.
We bring in Nestor Lecanto now as a U.S. Missile Defense Agency team is on island scouting for multiple locales for a massive new missile defense system to protect Guam and its military assets from potential attacks. Nestor talked to JRM Commander Rear Admiral Benjamin Nicholson about this developing issue.
What we're looking towards this Missile Defense Agency system is a more comprehensive integrated air and missile defense system that would cover the entire island 360 degrees. Now, the actual system that would be installed hasn't been decided upon yet. There's a couple of different technologies that are being looked at. It may be one or the other or a combination of the two.
The Admiral says for several years now, the Indo-Pacific Command has identified the need to bolster Guam's missile defenses. The game changer was a $270 million appropriation from Congress to the MDA late last year. It provides the initial funding for what we now know will be a massive new project.
Because the new system will defend the entire island and reach out to other parts of the region as well, too, it's going to actually have parts and pieces in multiple locations. And so what we're really focused on with the Missile Defense Agency as they're here is looking at the existing Department of Defense lands and seeing, can we make all of the parts and pieces needed to make the system work fit on the lands that DoD currently has in possession.
One of those parcels is Eagles Field in Manguilao, which has been Governor Leon Guerrero's first choice for a new hospital complex. It's now one of many other military-owned properties previously targeted for potential return that will be affected.
Some of the lands that maybe last year were listed as excess probably won't be listed as excess anymore, just to give us the time for the Missile Defense Agency to do what they need to do to figure out, would we need this particular plot of land or not for the defense system.
For Guam's News Network, I'm Nestor Lecanto.
Tomas Manglonia has regional headlines, as he always does here on The Link, as the CNMI reaches a 98.7% vaccination rate, but the front line is beefing up their efforts and prepares to have more COVID treatment available throughout the Marianas.
The CNMI has a growing arsenal of COVID-19 treatment in its battle against the virus.
We are pretty much, well stocked, and we have currently about 10 different kinds of therapeutics for treatment and even for pre-exposure prophylaxis for COVID.
Still in its first surge, double-digit daily case reports throwing the total case count to over 4,000. There are 435 active cases and 6 hospitalizations.
For Region Cove, we have, I think, for all the sites that we have, about 700 has been given for Region Cove. That's the main map that we are administering. One, because it's, it's still effective for Delta, and it is being administered subcutaneously, 4 sub-Q shots.
Omicron hasn't been detected in the CNMI just yet.
It's not been confirmed yet, so we have Sotrovimab. Just in case that will be confirmed in CNMI, we will shift to administering Sotrovimab, which is an IV infusion, one-time IV infusion.
She says if you're in the NMI and you test positive for COVID, the first thing you should do is call the COVID hotline. The treatment is available across the NMI hospital clinics. She says the pharmacy reports how much treatment is left on a daily basis.
It's an additional task, but it's something that is needed. And it's good that we can all help each other to cover what is needs to be done.
We want to get you up to speed on that federal suit by Earth Justice and Prutehi Liteksan against the United States Air Force now, as they are suing for the federal government's alleged failure to comply with environmental policies with plans for open burning and open detonation for northern Guam. And they're highlighting just how dangerous this practice could be.
The Air Force is moving ahead with seeking permission to literally blow up bombs on the beach of northern Guam without looking at safer alternatives, ways to dispose of munitions without blowing them up in the open on ancestral lands.
Earth Justice and Prutehi Liteksan seeking a legal remedy after the U.S. Air Force submitted an application to renew its hazardous waste permit for open burning, open detonation at Taragi Beach at Andersen Air Force Base. They say the Air Force failed to take a hard look at environmental impacts, violating the National Environmental Policy Act.
If you look across, the United States at various communities where open burn is happening by the U.S. military, there are extremely high rates of particular forms of illness, cancers, all kinds of environmental issues. There's issues of water contamination, soil contamination. There are towns that basically have to have their water tested on a very regular basis because the contamination is so high.
It's an issue with global reach. In a U.S. Special Inspector General report assessing open burn pits by the U.S. military in Afghanistan, it was found that military and civilians were put at further risk from the potentially harmful emissions.
It's really unfortunate that the same attention hasn't been paid to open burning and open detonation domestically. It's not just something that happens during wartime in another country. It happens in everyone's backyards, right? It's happening on the beach on the northern coast in Guam. And while open burning hasn't occurred for a couple decades or so, open detonation still very much is happening.
The Special Inspector General for Afghanistan Reconstruction report notes DoD communication, writing that burn pits should be a short-term contingency when there's no alternative. The Obama administration launched a registry in 2014 to better understand the impacts of exposure to airborne hazards during military service. In 2019, Trump signed into law legislation that would phase out the use of burn pits. Earth Justice says the big question is why the wartime practice is planned for Guam.
Why are you doing this? What are the impacts? And what are the better ways that you could do this without causing harm to, the environment and the people of Guam?
The law is not new, but if plans move forward, the effects could be irreversible.
This application for the permit is not a new application. It's a renewal application by the Air Force, and they've been making these applications to the Guam EPA over several years. And I think an important thing to remember is science changes and it innovates and it improves on methods that are going to be really geared to take care of our environment. And I think it's important that the Air Force has to answer to this, and it would be their burden to show through an environmental study, through an environmental assessment, what those alternatives are. It's not our burden to say that.
And of course, Pacific Points are our proud sponsor of Link Headlines every single day. And thank you to our friends at Pacific Points. They've been with us since the very beginning. Thank you guys for what you guys do. And thank you to Uncle King Conception because he is bringing you, as he does each and every day, your Chamorro News.
Buenas tardes to get some to be finished tomorrow in the KUAM News. Present any familiar Mizo give First Hawaiian Bank. Iotenta na Ruben Pedra Spaxolovid sa matumagi estagi isla gimapos na semana. Desta mama distribute gati Guam Memorial na Hospital sa Guam Regional Medical City na Hospital. Spokesperson pa Guam Memorial na Hospital si Maya Habib confirma na maresibi pati niya lo asangan na trabia timan mananay prescription para este na amod. Ilingan este na amod sa nisita ifon matnay na concerned pharmacist laboratorian baseline sa masenpulan ni izo ni malango na medical insurance. Asangan lo kay na Guam Memorial sa mafatututsu idupot siya reglamento para este na amod. Bago GRMC sa paro mananalo tati maresibi na Paxlovid gin ni Departamento ng Salud Publiko. Spokesperson B is Cindy Hanson. Asangan nataza na GRMC clinic outpatient para Exhibition General Healthcare. Di sina manay este na amo di publiko. Masasunto, Guam Education Board sa mabota todo ni membro niya para may lihi de nuevo si Mark Mendiola dan si Dr. Mary Okada para chair and vice chairperson. Dito niya board meeting ni masusesa di kada mes gi ipahingi. Minat ka estimi na chess biyahe na may lihi si Mendiola da segundo biyahe para si Okada. Dumania dos para manayad mas dangkulo na agradecimiento para i-board ni Masedi siya para matsogitaro este gi mamayla na term. Ilaing guaan sa orde ni board na maazik official niya gi premier na meeting niya gi Enero na mes kadasakan. YouTube na sunto gi pinut sa moro para pago na Webes gin ni KUAM News. Guam Community College na estudyante siya sa mamanay lugar para maadsik ko Farhano para eskwela para matsogya ay remote learning bago na semester. Segundo Director Communications and Promotions si John De La Rosa asangan ay para maadsik ni estudyante sa pwede ikaw sang COVID gi campus eskwela. Lenya na pwede kinahuli ikaw sang COVID gi isla, pero fan manay oportunidad at post-secondary na estudyante siya para makontinue ay class and internet. No like na loki na siya manzing na estudyante, itang ginamalago fan matugat gi GCC. Man manay oportunidad para fan manungo online para 2 semana na tempo, desde este mamayla na dunas. Do sempre ma-evaluate hinanaw niya, so marikla kung necesaryo. Para Guam News Network, Guausican Conception. Yasuto Finutsamuru sa presenta za ninafatto ni Familia Mizugi First Hawaiian Bank.
Say hello to the First Hawaiian Bank mobile app, where you get smart insights into your finances so you can make smart decisions with your money. With a daily personalized feed, you can compare your monthly income to spending. That's better. Discover where your money is actually going. You might be surprised. See what's essential and what isn't. The more you use the app, the smarter it gets. With insights from the First Hawaiian Bank mobile app, it all starts with yes.
Do you feel like you're missing out on something? Make life more rewarding with Pacific Points. Earn and redeem points for bill rebates and free load at IT&E, discounts on fuel at Shell, vouchers at Foodies, and United Mileage Plus miles. You can even pay with Pacific Points at IT&E, Shell, and Foodies. Pacific Points. Do more, get more.
The relationship between Guam and Manila, Philippines is undeniable as we share similar cultural traditions, history, and heritage. With generations of Filipinos calling Guam home, KUAM presents a monthly look at the capital city featuring in-depth and engaging interviews on everything from medical tourism to new business and government leaders. Veteran newscaster Nestor Lecanto delivers Beyond Our Borders. This special program is brought to you by KFC and the Medical City, where patients are partners.
Get the job done the right way by getting the right stuff at East West Rental Center. With years of experience helping builders, we definitely got what you need. Call 646-1463 or visit us in Upper Tumon. Open Monday to Saturday from 7 a.m. to 5 p.m. and on Sundays from 8 a.m. to 5 p.m.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Get the job done the right way by getting the right stuff at East West Rental Center. With years of experience helping builders, we definitely got what you need. Call 646-1463 or visit us in Upper Tumon. Open Monday to Saturday from 7 a.m. to 5 p.m. and on Sundays from 8 a.m. to 5 p.m.
Mariana's Irrigation and Landscape Superstore. Stop on by and visit our showroom today. We offer everyday low prices on all major outdoor power equipment like bush cutters, chainsaw, power washer, generators, and more. Need service, repair, maintenance? Well, check out Guam's best superstore only at Mariana's Irrigation and Landscape, located in Barragata along Army Drive between Submarina and Besta Market. Call 735-7446 for more information. Now shipping to surrounding islands. Mariana's Irrigation and Landscape Superstore.
Join Nestor Lecanto for virtual in-depth discussions with the movers and shakers in our community every Wednesday on In Full Zoom. Presented by IT&D and Calvo Enterprises, Inc. KUAM Communication is your go-to source for the biggest national and international sports events. Check out KUAM TV 8 and KUAM TV 11 for the biggest sports specials, championships, and events from every court, track, field, and playing ground. We're bringing you all the action and excitement. Brought to you locally by Mariana's Irrigation and Landscape and Docomo Pacific.
Pizza Hut's stuffed crust is the crust that made crust good. Topped and stuffed with over a half-pound of cheese. What are you so afraid of? Loving it? Original stuffed crust, only from Pizza Hut. No one out-pizzas the Hut.
Taco Bell is so good and so cheap.
I know, right? I wonder why.
What if they know we're broke? What if they're trying to be the good guys?
Yeah. Thanks, Taco Bell!
KUAM's multi-platform morning show, The Link, just got a little more delicious with Feed Me Fridays. Chris, Sabrina, Jason, and the rest of the morning crew will take some time off each Friday to talk, taste, and tempt you with all the latest and greatest food and drinks on Guam. Old faves, new hits, and everything else we can put in our bellies. It's Feed Me Fridays on The Link. Brought to you by King's Restaurants, Ruby Tuesday Guam, and Devondale. Real milk from free grazing cows.
We know you're tired of hearing about COVID-19. Some of you are probably wondering whether this is ever going to end. However long it takes, we all have to do our part, including our children, to hold the line. You can protect yourself and your family by getting vaccinated.
And if you're already vaccinated, don't let your guard down because you can still give and get COVID-19. And if you're not vaccinated, remember that if you catch the virus, you could suffer more severe complications. At the end of the day, it's the choices we make to protect ourselves, our families, and our community that will control the spread.
We know it sounds repetitive at this point, but again, wash your hands, watch your distance, and wear your mask.
Together, we have to hold the line.
Let us know what's up on our KOM News WhatsApp tip line at 671-727-0094. Share information about what's happening in your town, on Guam or the CNMI, and what you want us to know. Reach us on WhatsApp at 671-727-0094.
See what's on TV tonight with schedules, network news and notes, local promotions and giveaways on KUAM Communications social media pages. Like and follow us on Facebook or Instagram now for all the latest and never miss out.
Each morning on Breeze 93.9 FM.
I don't go to Tumon Bay. I outgrew my circus days. I just love the east side ways. I don't want to go to town. I don't like to drive so far. There's no place to park your car. I don't drink martinis, don't smoke cigars. I don't wanna go to town, just feel the breeze and the sun. I'm with my friends when the work is done. Relax in the shade. We're easy to
Hey, good morning. Yeah, Jay was talking about the home test kits, and Link Fam member Amy commented in, if you test positive using a COVID-19 self-test, report your result to dphs.surveillance@dphss.guam.gov.
There you go.
To confirm your results, visit a healthcare provider or any other COVID-19 testing site. Okay. Good morning, The Link. Good morning. It's Pacific Points, Cabo Enterprises, IT&E, and Jack in the Box. Just comments real quick before we get to our interview. Rosemary, the lines at TZN dropped because another testing site was open at Guam Radiology Center. The Balbins. Good morning, Balbins. The testing site at Guam Radiology is an average wait of 2 hours standing in line. And this is a standing in line thing, guys. My daughter tests her every week for work. It wasn't this long of a wait before, but due to TZN cutting back, she waited for almost 3 hours last week, and the line was wrapped around to the back of the building.
And again, since they're mentioning TZN, we just want to say, we've been trying to stay ahead, on top of the status of the Eventbrite system. Today, Friday, and Saturday, with the TZN testing site fully booked. So if you are in need of testing, you can go to your private clinics. You can go to the OCA testing site now, as a comment is just saying thank you for that good info.
Yeah, thank you guys so much. Let's head into the Link Zoom room where Robert Celestial of Pacific Area Radiation Survivors is standing by here with an update on the Radiation Compensation Act. Rika, Robert, good morning.
Unmute Robert, please.
Good morning, Chris. Good morning, Sabrina. Good morning, Jason. Thank you for having me this morning. It's wonderful.
Yeah.
It's always wonderful to give a little brief. Yes, the Senate signed a resolution declaring January 27th as Remembrance Day for Downwinders. And people of Guam remember that Guam was designated as, recommended to be included in RECA, which is the Radiation Exposure Compensation Act, as downwinders. So we, with our partners in Idaho, New Mexico, Utah, and the Navajo Nation, are coming together to bring this issue up, to remember all those that have passed and those that have been suffering for so many, many years. And hopefully our bills would be passed this year before July. And also, just to let you know, I was contacted by the governor's staff yesterday and asked if I could give them a brief. But the governor's off island; she's in Washington D.C. So I wrote them a brief who to speak to, who we already contacted, and they said they wanted to speak to Senator Crapo, Senator Lujan, and I said we already had a Zoom meeting with them, and that our target point for Guam, for the governor, is Senator Hirano from Hawaii. So hopefully she could get an audience with her and get her on our side. I will be meeting with the chairperson Durbin Saturday our time, Friday their time, this Friday, and so hopefully we're meeting with their staff, Reader Seaman, so we could probably convince them to put it on the table as on Senate Bill 2798, because the House bill is already passed the Judiciary Committee, and so it's now up for a vote. We have two groups. We have the Frontline Community Group, and then we have the RECA group. And these two groups have been lobbying Congress, and that's how we're able to get all these Zoom meetings with all these senators. And I get to go with Senator Sparks tomorrow from Indiana and try and convince her to co-sponsor. Other Frontline Community are meeting with Feinstein, Representative Feinstein, and Gaines, and other representative, also different senators. So that's what's on our agenda for this month, and hopefully that also that with this Remembrance Day, which is today on Guam time, but tomorrow on Washington D.C. time, that one day, what's her name, Speaker Wonpat passed the bill for Guam for a Downwinders monument. I don't know if you remember that. So we've been working on that. All we have to do is submit documents to the legislature and get it approved, and hopefully we'll get it erected up at Skinner Plaza. So and then that will match up every January 27th, so we could commemorate this day for the people of Guam.
Nice, Robert.
And,
can I just? I'm sorry, Robert. So you said that the governor is. Did you say she was going to be testifying?
No.
Oh.
No. I would just ask for a brief to give the governor who to contact when she's there in Washington D.C.
I see.
So our target that I gave them is Senator Hirano from Hawaii. Yeah. We already spoke to several senators. Matter of fact, the chairperson from the last Congress was Senator Grassley, and the chairperson, what's his name? Got so many of them. Jerry Nadler from New York. Spoke with Grassley to try and get some going in the Senate, because the bill already went to the House. So these are the things that's happening in Washington, D.C. And so what I did was I gave the governor some information, like who to speak to, who should she meet, and hopefully she can meet with what's her name, Chairman, the House Speaker Pelosi. That would be good. And because I believe the House bill is already, hopefully it will get passed and then go to the Senate. But we're working with the Senate right now. That's very important, because they're the ones who we believe that might. We're hoping it'll go through the Senate. I don't want to say anything negative about the Senate, but hopefully it'll get through. So that's who we're working with. We worked with the House, and we were successful. And so hopefully the people of Guam we know that January 27th is the day of remembrance for downwinders.
Yeah, Robert, because the governor, you're right, she is off island, and we just got this from Crystal Paco San Augustine that she's currently right now in San Francisco meeting with Region 9. I don't know which Region 9 of what. She'll then be heading to D.C. to participate in the National Governors Association winter meetings from the 28th to the 31st. She'll also be testifying for the Senate on February 1st. And so that's why I asked. They didn't say what she's testifying on. I did ask. So I don't know if it was that or something else.
No, we really, I'm really happy that they reached out to us and that we're able to share information. I gave them a whole brief, who we've been meeting with, which senators, which congressmen, and who our target is. And I really truly believe that if we could get Senator Ron on our side, that'll be a benefit for the people of Guam. And we're trying to get Senator Ted Cruz, Senator Cornyn from Texas, Senator Lee and Senator Romney from Utah. So hopefully we could get them on board. But the other folks from the Frontline Community group that we meet every Thursday are reaching out to these senators. And I would be meeting with Senator Durbin, which he's the chairperson for the Senate on Saturday, our time, and another Senator Sparks from Indiana. So hopefully we get Senator Sparks to co-sponsor the Senate bill, and hopefully we could get the ear of Rita Seaman. She's the senior legislative staff for Senator Durbin. Right. So that's good news. I'm just happy to be plugged in and speak on Guam and how Guam needs to get into the picture. Amen. So it's very important.
Yeah, thank you, Congressman.
Yeah.
I got jokes. No, Robert, could we go over the eligibility real quick? Because I promised our people this morning that I would tell them how they could get money.
Oh, excellent. Yeah, eligibility criteria for this amendment that hopefully gets passed is that if you were in Guam for at least 1 year, from 1946 to 1962, and you have compensable disease, and there is a list on Google, and if you have the compensable cancers or chronic diseases, then what happens is that you may apply for the disability benefits in RICO. And so hopefully what happens is that you'll be able to be adjudicated. Let me close the window. Got an airplane coming through. Yeah. And so that's the eligibility criteria. And they extended it for 19 years if our bill is passed. So anyone on Guam that has compensable diseases and you were in Guam from, for at least 1 year, let's say you were here from 1946 to 47 and then left to the States, you're eligible. You meet the eligibility criteria to apply for your compensation.
Thank you, Robert.
I wanted to follow up on the press release, Robert, that you sent out on the 25th regarding urging our government leaders to observe today as a day of remembrance for all downwinders. So is anything going to be done today, or have you received a response?
Proc signing, maybe?
Well, I urge them to support us. I haven't heard anything from anyone from any government agency that would sign any kind of proclamation, because like Idaho and New Mexico, they sign proclamations. This is today, January 20th. Hopefully, in the future, they might come up with something like that for the people of Guam. So I really believe that if we get all the support from the legislature, governor, and the congressman, right now our two groups, the RICA working group, which is a large group, and they have a lot of great individuals there that are lobbying Congress, and then our Frontline Community group, and we meet every Thursday. We come up with all kinds of ideas, and we contact all the senators and congressmen, and that's how we're able to get all the meetings. And I'm really happy to get invited to speak with the senior legislative staffer, Rita Seaman from Chairman Senator Durbin. And that's going to be exciting. I get to explain what happened in Guam.
That's great. We're so proud to have you represent us, Robert. And thank you so much for these updates. And you don't say Happy Downwinders Day. So what do you say?
we're working hard to get you the benefits. How's that?
There you go. There you go. So
Yeah.
we recognize all of the downwinders on Downwinders Day today, January
Yes,
27th.
we recognize those that have passed and those that are suffering today. And by the grace of God, we're going to get it passed.
Amen.
And thanks so much, KWM, Chris, Sabrina. This is a great opportunity this year, and I'll continue to pray.
Amen. Thank you, Robert. Always great to have
Keep
Robert.
us posted on the monument, the memorial, Skinner.
Yes, that's we're going to try and get that done this year.
All
the
right.
monument.
Cool. Right on.
Yes, we're going.
Okay.
Yes,
Thank you. Now's the time to ask Robert's election year.
definitely.
Get her done.
Yeah, 7:37. We got a quick break, and then we're going to come back. Guys, a lot of people, so they had the emergency rental assistance program, Bree, and they've now come out with the, is it the HAP? What is it?
Yeah, it is.
Homeowners.
So Nestor Lecanto did a interview the other day for Info Zoom with our
Yeah.
friend Audrey Topazna, of course, from
Yes,
the Department of Administration, breaking down exactly what the homeowners.
Yeah.
There you go. There's a little tease at the Homeowners Assistance Fund program. So what we're going to do is we're going to.
So the half.
Yeah.
The
So
HOF.
I mean, they talk about what the motivation was behind it. Of course, how do you qualify? But we're going to play you later on in the show the FAQs, the frequently asked questions, and the most common things that bubble up and what you need to know about taking advantage of this program.
Is different from the era?
Yeah.
Yeah, so Era was
we
for
stopped
renters.
doing we stopped doing those Era ones like when you left. Remember, because
Yes.
Chris was like, "Gee, if I have trouble paying my bills,
Yeah.
Sabrina, what options do I have?" And you're like, "Well, Chris." so that ended like right around Christmas and everything. But this is right on the heels of that, and this is there are considerations in this for mortgage relief, a variety of things and everything. But Audrey goes into great detail about it, but she explains it extremely well too. So you're really gonna like this.
Right. Thank you, Jay. That's coming up next, actually, 7:38 right here on The Link. We're brought to you by Pacific Points, Calvo Enterprises, ITE, and Jack in the Box. And again, just a little more clarification on exactly where your governor is. We had Dr. Berg had said something, I don't know why he would say that she went to D.C. to check on her test kits. But the official word here from the communications director from the Office of the Governor, Governor Leon Guerrero is current in San Francisco meeting with Region 9. She'll then be heading to D.C. to participate in the NGA, National Governors Association, winter meetings from January 28th to the 31st. She'll also be testifying for Senate on February 1st. Joining her is First Gentleman, and Chief of Staff will also be heading out shortly to accompany her. So there you go.
Region 9 is in USCPA.
I don't, well, there's...
It's in possible burn pit issues
Right,
and
yeah,
stuff.
so there you go. Yeah, and as for the limited supply, and this is a quote from our Daniel Perez's story interview with Dr. Berg. He says, as for the limited supply of test kits on island, Dr. Berg confirmed that more were ordered before the supply thinned out and added that Governor Liu is in Washington to ensure that Guam gets its fair share of test kits. So maybe they're doing like a test kit thing at the NGA. We don't know. And I don't know what she's testifying on. Usually you would put that out in the initial statement, but I did ask again for supplemental information. Is there anything you're tracking, Bree, in the Senate, February 1st?
No, I'm just
Okay.
waiting to see what's going on with the Build Back Better.
Right, yeah.
And
So-
what's up with the money from the infrastructure
Yeah,
law.
maybe that's it. That's it.
Okay, and sorry, real quick, Tomas Mangloni, he just like popped in and everything like that, and there is going to be a press conference which we're going to live stream today on our Facebook page at 4:30. Apparently, the CNMI Senate is convening, and they are going to discuss the ongoing impeachment proceedings for Governor Ralph Torres. So that's at 4:30 on our Facebook page.
2 o'clock? What about the 2 o'clock?
What's that?
The Congress, isn't that today? Or is this new? Congressman Michael St. Nicholas? I believe that's today. I think I got this while I was in the air, yeah. They've been invited to a policy briefing by the Guam Congressional Office Thursday, 2 p.m. This is it's Thursday today, right?
Yeah. So he invited the senators, right?
Right.
Yeah.
On legislation to create native contracting status for eligible Guam businesses and to receive the latest official research update on establishing a Guam constitution. But there's a lot of other questions that he's
Yeah.
willing to
I'm sure.
take. But that's at 2 o'clock.
I just want to say, with the day of the week and everything, Bree, you look and sound fabulous, considering like, is jet lag kicking your ass at all?
Not yet.
Not yet. Yep. No, hey, this girl.
We'll check you out around lunchtime and
she's
see how
happy
you're
to be here. I showed up to work this morning and she was like reverse parked, and
Considering you've crossed what, like
I was like,
11 time
that
zones
is
to
some
get here?
drive right there. You reverse park, you about the business.
Yeah.
Welcome back.
Got
Bree.
a lot of stuff to do this year.
Yeah, God, you're giving me a headache. It's 7:41. Quick break, and we're back with more info on the HOF, the Homeowners Assistance Fund, next, right here on the link.
Get the job done the right way by getting the right stuff at East West Rental Center. With years of experience helping builders, we definitely got what you need. Call 646-1463 or visit us in Upper Tumon. Open Monday to Saturday from 7 a.m. to 5 p.m. and on Sundays from 8 a.m. to 5 p.m.
Mariana's Irrigation and Landscape Superstore. Stop on by and visit our showroom today. We offer everyday low prices on all major outdoor power equipment like bush cutters, chainsaw, power washer, generators, and more. Need service, repair, maintenance? Well, check out Guam's best superstore only at Mariana's Irrigation and Landscape, located in Barragata along Army Drive between Submarina and Besta Market. Call 735-7446 for more information. Now shipping to surrounding islands. Mariana's Irrigation and Landscape Superstore.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Do you feel like you're missing out on something? Make life more rewarding with Pacific Points. Earn and redeem points for bill rebates and free load at IT&E, discounts on fuel at Shell, vouchers at Foodies, and United Mileage Plus miles. You can even pay with Pacific Points at IT&E, Shell, and Foodies. Pacific Points. Do more, get more.
The relationship between Guam and Manila, Philippines is undeniable as we share similar cultural traditions, history, and heritage. With generations of Filipinos calling Guam home, KUAM presents a monthly look at the capital city featuring in-depth and engaging interviews on everything from medical tourism to new business and government leaders. Veteran newscaster Nestor Lecanto delivers Beyond Our Borders. This special program is brought to you by KFC and the Medical City, where patients are partners.
Let us know what's up on our KOM News WhatsApp tip line at 671-727-0094. Share information about what's happening in your town, on Guam or the CNMI, and what you want us to know. Reach us on WhatsApp at 671-727-0094.
We know you're tired of hearing about COVID-19. Some of you are probably wondering whether this is ever going to end. However long it takes, we all have to do our part, including our children, to hold the line. You can protect yourself and your family by getting vaccinated.
And if you're already vaccinated, don't let your guard down because you can still give and get COVID-19. And if you're not vaccinated, remember that if you catch the virus, you could suffer more severe complications. At the end of the day, it's the choices we make to protect ourselves, our families, and our community that will control the spread.
We know it sounds repetitive at this point, but again, wash your hands, watch your distance, and wear your mask.
Together, we have to hold the line.
Listen, watch, and learn from the daily Tomorrow News updates from KUAM News. Catch them on the link during the 8 o'clock hour, streaming online on Isla Radio, or on the KUAM News YouTube channel for your convenience. Tune in and stay informed, all while preserving our precious culture through the daily use of our native Chamorro language. Tomorrow News updates are brought to you by your familia at First Hawaiian Bank.
Mariana's Irrigation and Landscape Superstore. Stop on by and visit our showroom today. We offer everyday low prices on all major outdoor power equipment like bush cutter, chainsaw, power washer, generators, and more. Need service, repair, maintenance? Well, check out Guam's best superstore only at Mariana's Irrigation and Landscape, located in Barragata along Army Drive between Submarina and Besta Market. Call 735-7446 for more information. Now shipping to surrounding islands. Mariana's Irrigation and Landscape Superstore. Stop on by and visit our showroom today. We offer everyday low prices on all major outdoor power equipment like bush cutter, chainsaw, power washer, generators, and more. Need service, repair, maintenance? Well, check out Guam's best superstore only at Mariana's Irrigation and Landscape, located in Barragata along Army Drive between Submarina and Besta Market. Call 735-7446 for more information. Now shipping to surrounding islands. Mariana's Irrigation and Landscape Superstore.
Breeze 93.9 FM.
Good morning. Yeah, I don't know if you guys saw this graphic here from the Guam Department of Education. Let's throw this up as you guys are getting ready to drop your kids at school. As GDOE, they do a community dashboard, right? And I know a lot of parents, myself included, are kind of scratching our heads, wondering, especially when the Catholic schools went online, what response, action, reaction, if any, GDOE would take. We did have the superintendent on yesterday, and he said that they would, if there were going to be any moves or decisions to go either back to online or to close a school or whatever, it would probably be like piece by piece. So they would say, oh, this school's got a lot of cases, so we might close this school, or this school has a lot of staff out, so we might close this school. But just look at this. Look at the conditions your governor is allowing your children to go to school in. 7-day new cases per 100,000 persons. 2620 high. A 7-day positivity rate, 27.1% high. That means 27% of the people, Jay, that they've tested over the 7 days have been positive. That's 30%. That's 1 in 3. How's my math?
Yeah, pretty much. And
Is my math good?
That's what last night's JIC report said too.
Yeah. And so,
but then again, that's just DOE.
Yeah, and so look at these numbers, guys. I mean, how do you not kind of like look at this and just be like, oh my God?
So what's the threshold to?
Well, we asked John that yesterday, and there is no clear threshold because this Omicron, since the governor said it's mild, and they're really eyeing the hospitalizations, all the metrics are out the door. And you're right, Bree. I know we were talking this morning. You said if this was Delta and these numbers, totally the schools would already have been shut down. And so look at that employees and student ratio of the cases.
Yeah, this is actually pretty impressive. 94%
right
of the staffers in the Guam Department of Education, by far the largest agency in Gov Guam, 94% are vaccinated.
Right. Go over to the student employee on the far right. Yeah, and then there's a pie chart over more to the right.
Oops.
Sorry.
There we go.
Yeah, here you go. On campus active
pie.
cases. Look at here. 157, 80% are students. 20% are employees. Yeah, and so I just got to go back to what Father Valid said is the community spread and the amount of cases in the community. I mean, it's high, all on GDOE's own metric. He said it was just so alarming that they had to like pause. And I think that was more what it was, sir, as he said that there was a pause because of the high cases and then also due to a test kit shortage. The GDOE management assessment here, guys. You guys ready for this? This is GDOE's management, how they're assessing these statistics. New cases continue to surge. However, hospitalizations and intensive care admissions remain relatively low. News, CDC, and public health guidance provide less restrictive measures, including shorter quarantine and isolation periods for the vaccinated. The central office is deploying assistance to address staffing shortages at schools. And GDOE is working with public health to expand testing capacity at school sites. What that all means, you still got school. All right, you got school. And this is the new normal. It is just the new normal. It's just you have to accept that that the people in charge have decided that the risk is not great enough to keep your kids home. That it's okay to send them out in the super typhoon. These are the governor's words. The super typhoon of Omicron. Which to me, it just blows my mind. Totally blows my mind because, I mean, again, we talk about the numbers game, 850 positives. How many of those 850 are going to end up in the hospital? How many of the, 700 some for the day before, or the 600 some, or the 700 some from the day before that? Right, Bree? Because, like when they get such a high number of positives, I mean, just by default, a certain percentage of them are going to go in the hospital.
Yeah, of Guam in general, of course, we're looking at the GDOE numbers.
Bree's like, I want to go back.
Yeah, in the aggregate right now, it went as high as 7,400 Guamanians at one time were isolated. That was earlier this week. Right now, it's 6,945 residents of Guam are currently in active isolation.
Yeah.
6,900 people.
Yeah, it's nuts.
That's almost like filling the UOG Fieldhouse 1.5 times.
Yeah,
because
exactly.
it can hold about like 4,000.
Rosemary
That's a lot of people.
Rosemary Laguardia, this is a funny set of comments here. Bev Test says, FYI, we are in Typhoon Omicron Condition 1. And then Rosemary said, I believe the administration downgraded it to a tropical depression. Yeah, the governor told us it's a super typhoon, but the response is Kalen Banana Typhoon. 7:53. Let's go ahead and play this interview, guys. How to get money, especially if you're a homeowner. I mean, this is big because they had the rental assistance, but I know a lot of people who own their homes and are paying the mortgage struggle just as much, right?
Oh, yeah.
Mm-hmm. And so we have the FAQ portion of this interview that Nestor did with Audrey Tapasnia.
That's correct. Yeah, on the Homeowners Assistance Fund program administered by DOA.
Thank you.
In Full Zoom is presented by Calvo Enterprises. In Full Zoom is presented by Calvo Enterprises Inc. In Full Zoom is presented by Calvo Enterprises Inc. and IT&E.
All right, so let's go through some of the questions here. FAQ. One is, my mortgage is in forbearance. Could I qualify for assistance?
Yes, forbearance is an eligible expense if your mortgage is in forbearance and or deferment. I think, Nestor, that's really important that the Treasury recognizes because, yes, the program is designed to help homeowners with their mortgage loan so it can be current. And one thing that I've been learning throughout this whole process of this application is when mortgage loans are under forbearance or deferment, the bank really views it as their loan is current, even though you haven't made, because it can be on forbearance for 3 months, 6 months, even though the homeowner actually didn't make any payment, but their loan is considered current status. So I'm glad the Treasury recognized this, that we should also include those homeowners because their mortgage loan is not necessarily in default or past due. So yes, if your mortgage loan is under a forbearance plan or deferment plan, and the homeowner is determined eligible, you will be able to receive assistance.
All right. So Audrey, the next question is, am I still eligible to receive assistance if I'm back at work?
Yes, you can still be eligible. Maybe you weren't currently affected by COVID with your employment, but maybe you have reduced hours, or maybe you experience a COVID, you experience a financial hardship. Maybe someone in your household was positive and you had to take them in, or maybe some medical expenses. So it doesn't necessarily mean that financial hardship is only related to employment. And I'm glad that you brought this up, Nestor, because I did want to give a few more examples of what does it mean by experiencing a financial hardship associated with COVID. And of course, it's always a given that you're affected through employment. But and I think I mentioned that. So other examples could be, maybe you had to pay additional medical expenses. Maybe you had to purchase all these PPEs. Maybe you had to sign up for internet because your children are now for up to today. I mean, my child is, everyone's online now for the next 2 weeks. So, and those expenses can really add up, and it's unexpected. and it's all because of COVID. So those are some examples where maybe both homeowner, mom and dad, did not lose their job, did not get a reduction in hours, but they had all these extra expenses. And now, so bills are falling behind, utilities are past due, your mortgage is, you're barely making payments. So that can also be a result as, or qualify as a financial hardship.
All right, good to know. So you're not automatically DQ'd if you go back to work. All right, next question. Yes. Do I have to be behind on my mortgage payments to qualify for mortgage relief assistance?
For the initial, your initial pre-application, you do have to be behind, or you could be on a forbearance or deferment plan. So initially, it's either behind by one payment or in a forbearance or deferment plan. And then moving forward, once you receive assistance and you need to apply for continued assistance, and this is what we call prospective monthly payments, you can qualify for assistance, and then every month you will be reassessed to make sure you still qualify, and then you can continue getting that assistance.
Okay. I am late on my homeowner association fees. Can I apply for assistance with the program?
Yes, homeowners association does fall under our property assistance relief program.
Okay, yeah, we mentioned that earlier, as a matter of fact. I don't need help with my mortgage, but I have fallen behind on my utility payments. Can I just apply for utility assistance?
Absolutely. You can apply for just power or power, water, and trash, a combination. It's really where that need is pertaining to your situation.
Okay, and we mentioned this earlier, but it's worth mentioning again. Will I receive assistance directly?
No, all financial relief assistance will go directly to your bank and the utility providers and Treasury of Guam for property tax or your homeowners association program management, property management.
Okay, some general questions. So you guys have been through this before with the rental assistance relief program. What were the challenges there, and do you expect those to be similar challenges for this program?
So I think one thing that we're really excited, because we did learn a lot of lessons learned through the ERA program, is that we're able to have now the pre-application online. It was, I think with the ERA, dropping off the applications and having just hard copies. And, of course, nowadays, it makes it so much easier to just apply online, submit it, and then wait for our office to let them know if they're pre-eligible or not. And so just being able to do that online submission is really a huge plus for us. And I think notifying, actually, no, let me kind of step back. Having the staff on board already, because when we first started the ERA, it's we were going through just a couple of the partners assisting the Department of Administration. But now that we were able to have our staff on board, we actually just finished hiring one of the last of our staff. And so we're excited because we're all on board, and because it was difficult. I think ERA, if I recall back, received about 2,000 plus just the first round. So it was kind of crazy, but we were able to, get through it. Yeah, so we're really looking forward to seeing those homeowners apply online. Of course, if for those, depending on their situation, and you have to come in to our office, we are ready to issue our pre-application, and then they can also drop it into our Dropbox that we have available at our office.
Yeah, and what's your sense of what the demand will be? Will there be a high demand for this as well?
I believe so, based on the for the past couple of months since November, since we officially opened, we have been. I mean, there's over 100 that were on our list that we had to contact to let them know, and we have received a lot of emails. So there is, and then all the couple of meetings we had with the mortgage lenders, they were sharing that they do have a lot of taking a look at all the banks combined. It's over 1,000 to 2,000 homeowners that are really in need of this assistance. So we hope that we are able to provide relief assistance to everyone who applies, and that we're able to keep them in their homes and get this funding out to them.
Okay, Audrey, let's just wrap this up with one more time. Just invite people to apply, when, how they do it.
Okay, so our pre-application is going to be available Monday, January 31st. Of course, we highly encourage that everyone apply online at doa.guam.gov. They can also call our office at 638-3814 if you have any questions, or visit us at our office located on the second floor of the ITC building, 8 to 5, Monday through Friday.
All right. Audrey Chapasna is the program director for the Guam Homeowner Assistance Fund program at the Department of Administration. Thank you very much.
Thank you so much.
I'm Nestor Lecanto. Thanks for watching, everyone. We'll see you again next week on In Full Zoom.
In Full Zoom is presented by Calvo Enterprises,
Inc. Got you,
and
Guam on the radio. Let's go ahead and jump over to KUAM TV. Fix yourselves, KUAM TV. Here we go. Guam. It's 8:03 Thursday. Guess who's back? Back again. Sabrina, my good friend. Good morning, Sabrina. Welcome back.
Good morning. Thank
Channel
you.
8's viewers just went sky high. I know they ain't watching the three of us.
Nah, they're tired of us already. Joe, Sir, Jason, this is the link brought to you by Pacific Points, Calvo Enterprises, ITN, and Jack in the Box. Sir, you want to get that rainbow outside? I think we could use a little rainbow. Sorry, I know. Calling an audible. It's 8:03. Our 8 o'clock newscast is coming up here.
Primo Patrick Salas is saying, hey, who's the new girl?
We decided to beauty up the place. Hey, Jay, can you go over before we get into the news?
Look at that rainbow.
That's so beautiful. Here's a little bit of rainbow for you guys this morning.
Okay, if you are a member of the Link fam in the States and everything like that, there's some island warmth for you. You guys can have the snow. I love snow and everything like that, but I would rather sweat than freeze. That's just me.
Right.
I love those rainbows.
Jay, before we get into the news, can you go over like the testing opportunities?
Sure, absolutely. Okay, so testing. Remember, you do need an appointment. We're going to repeatedly say this because the policy has changed. You do need an appointment if you are, in fact, in need of being tested. However, the URL to check is tinyurl.com/COVID-stops-with-me. Testing opportunities in Teadsden today, Friday, and Saturday. Fully booked right now for the old Carnival Grounds in Teadsden. We've got a story coming up with Daniel Perez in which Dr. Nathaniel Berg, of course, his company Guam Radiology Consultants, hosting their own testing site, but using, that's the way we, right, Chris?
Yeah.
Their own testing site, but using public health test kits. Right, that's at Oka. That's across the street from Payless in that big clearing area. So you can do, you may be able to avail of that. Again, you can always visit your private healthcare provider, give them a call, let them know what your symptoms are. If you're exhibiting symptoms, let them know what the situation is, and they'll certainly be able to help you out. That's testing. As far as vaccines, vaccine, you can go to tinyurl.com/VAXGuam. You can make an appointment to be seen at either the Dedido Northern Regional Health Clinic or the Southern Regional Health Clinic in Alahan. You can also use Eventbrite to make that, but because today is Thursday, remember on Thursday, the UOG Calvo Fieldhouse, not available because they are sanitizing that. However, After school vaccination clinics continue today, and today starting at 3 until 6 p.m., 3 until dinner time. It's going to be held at CL Taitano Elementary School in beautiful Sinania. So if anybody, Guamanians age 5 and up, if your little ones are in school, either virtually or face-to-face, if you do want to get them vaccinated, either the Johnson & Johnson vaccine, the Moderna, the Pfizer, get them their booster if they do in fact qualify. CL Taitano Elementary School today from 3 to 6. Also, real quick, because it is 8:05 in the morning here on a Thursday, starting in about 50 minutes, drive-through distribution will be held for food commodities from 9 a.m. to 4 p.m. at Asan Maina drive-through at the Asan Maina Village Mayor's Office. There are 350 bags, so if you are in need, please bring your card there, and they will help you out. If you have any information, call the Asan Maina Village Mayor's Office. Also, adjacent in PD, door-to-door distribution will begin today. That begins at 9:30 while supplies last. There are 150 such food commodities packages to be distributed to our friends down in PD. And then tomorrow, from 8:30 in the morning until 11:30, up here in Derido, the island's most populous village. It's going to be held right up the street from our KUM studios in Harmon at the Guam Football Association field. There are 1,000 food commodities packages to be handed out to residents of Derido only, please, in the northern village. That's going to happen tomorrow starting at 8:30 in the morning.
Thank you, Jason. 8:07. We'll just go ahead and get right into the news here. Our 8 o'clock newscast is brought to you by Pacific Points. Good morning, KUAM TV. We're also jamming on Facebook Live and, of course, on The Breeze with the very latest.
Yes. Okay, real quick, interesting comment from a Link fam member, both literally and figuratively. Maria Scro says, Sabrina, on a scale of 1 to 10, how much did you miss the boys?
10.
10. Nice. Good.
Okay, Joser certainly she's grading on the curve.
Yeah.
Joser raises that for the rest of us.
He raises it way high. 808 Pacific Points.
Well, we really
present.
missed you too. It's good to have you home.
Totally, Bree. It's great to have you back. Pacific Points presenting our 8 o'clock look at news with Jason Salas from the KUAM News team. Good morning, Jay.
All right, and of course your news link headlines, as they are each and every day, brought to you by our friends at Pacific Points, where Pacific Points you can do more and get more. And thanks so much to Pacific Points. Remember, if you need to get the K95 masks, visit any of the Pacific Points locations conveniently located near you. And remember, tell them the link sent you because they got those really good coffee cakes. You can get those there too. 1 in 3, my friends, is a major stat you need to know this morning as Guam has reached a new record high for single-day positive COVID cases. 850 test samples came back positive out of a sample set of 2,636. Those were tested on the 25th. So on Tuesday, that's a test positivity rate of nearly 33%. 1 in every 3 people that are being tested on that day turned positive. 167 of those 850 cases were reported by the Department of Defense. To date, there have been 29,478 officially reported COVID cases, with 282 deaths, and 6,945 of your fellow Guamanians currently in active isolation with the virus. Hospitalizations has gone up slightly. It's increased by 2. There are 36 island residents now admitted to the island's various hospitals, 20 at GMH. GRMC is housing 12, and the Naval Hospital has 4 such patients it is monitoring. 3 people are receiving ICU care, with 1 on a ventilator. Of those hospitalized, 25 Guamanians are vaccinated, and 8 have not received the coronavirus vaccine. Well, Public Health's new testing strategy in our link stories took effect today, and after more than 2 weeks of long lines at the Tizan test site, that's no longer the case. Daniel Perez was in Oka, where he files this story on the new testing site in Tamuning.
It was announced on Monday, and it finally came into play. Public Health's new strategy to test those who are symptomatic and high-risk close contacts seems to be working. Public Health PIO Janela Carrera was at the test site today and gave KUAM the latest on the testing situation.
Even starting yesterday, we saw the line kind of start to shorten a little bit, and then today it was a lot smoother. So, I think what it is the community heard our call. They responded very well. They're taking it very well. The business community, local government agencies, the school community as well, and just the community at large. They recognize this need to open up that line to those who really need to get tested, which is, of course, those who are symptomatic, those who meet the criteria for getting tested if they have a work exposure or household exposure, and those are the high-risk close contacts.
As we reported, the Tizan testing site, as well as the northern and southern community health care centers, will be prioritizing residents who need to get tested the most. These include those 65 years and older, unvaccinated or not fully vaccinated, those with multiple comorbidities or underlying health conditions, and those who are moderately to severely immunocompromised.
In addition to the Tizan testing site and its various partners, a brand new testing clinic opened up today run by Dr. Berg.
That site is run by Guam Radiology Consultants, and we're doing that for several reasons. The demand here in the building where we're located grew rather rapidly, and we wanted to be good neighbors to the other healthcare providers in the building who were having difficulty with their patients getting parking. Plus, it was a little more difficult when those who were coming for testing were wrapping around the building. So we looked for another site, and we were able to secure the site across from Ocopeles. That site is easier to organize, and I think easier for people coming in for testing.
Since the Tizan test site is only taking in those who are symptomatic and high risk, Dr. Berg assures residents that the one run by GRC will accept both symptomatic and asymptomatic patients.
What we're doing is following a policy of community involvement with judicious use of the supplies that are present on the island. And what that is the process is to try and encourage people to think twice before coming to get tested. No one will be turned away, no one. But we're asking people to say, if I was exposed to somebody a week ago and they were positive and I'm not at high risk, and I don't have family members that are high risk, do I really need to get tested? And it's, again, just saying, think a little bit twice because we want to make sure we're not running out of kits.
Dr. Berg added that the test kits being used at the Oka site are provided by Public Health and they are given an allotment to use for the day. The Oka test site is open from 7:30 a.m. to 2 p.m. Mondays to Fridays, but Dr. Berg said they are looking to expand the time and days. As for the limited supply of test kits on island, Dr. Berg confirmed that more were ordered before the supply thinned out and added that Governor Lou Leon Guerrero is in Washington to ensure that Guam gets its fair share of test kits. Daniel Perez reporting for Guam's News Network.
Well, as our island community is now in its fourth such COVID surge, the Omicron variant has made its presence known, especially with several local businesses. Jonah Goncharfers has this next story on how the variant has forced many such operations to halt.
With the island hitting triple digits in COVID cases for close to 3 weeks now, the impact has been felt by many of the businesses, from staff shortages to completely halting operations. For Andrew Arce, owner of Home Plate, a Kelaguen shop located in the Tomorrow Village, on Monday evening he posted on social media the shop would be temporarily closed due to potential exposure. Also having to cease operations is Subshack, and it's something owner Jonte De Leon has had to do on more than one occasion.
My family, we're all home, we're all quarantining, so our life right now is just kind of like at a standstill. We gotta rest, you gotta hydrate, so it's definitely feeling the impact at home.
My husband got hit with COVID first, so because we're in the same household and him and I both have businesses, we've had to close down business on both sides. And then of course, almost a week later, I got COVID. So even though we're both vaccinated, it still required, both of us shutting down. 5 days is still a lot of time when you have 0 employees and, you're your own employee, your own boss, your own accountant, your own runner, your own everything.
De Leon was cleared last week, but her 3-year-old son started to show symptoms and she had to shut down operations yet again.
It affects business a lot because you're just trying to catch up. And then when you catch up, it's like every little sick symptom someone in your family has, it's like you have to shut down because it's the responsible thing to do, and get tested. And even though a lot of places are, you can do appointments now, it's still a process to have to do all of that. And then, now we're waiting, 72 hours sometimes for results.
And for businesses that are affected, the worry starts to sink in.
What are we going to do? So it's definitely a challenge to remain optimistic in this market. We can't open. For one, even though we can't open, we still got all the bills to pay.
It's been what seems like 3 weeks of shutting down business and, there's no relief whatsoever financially. Bills still need to be paid.
With the island still in the pandemic and most recently this surge, both shops have had to make the necessary adjustments to accommodate this ever-evolving virus.
We're marketing it a little differently, because we understand that a lot of people are we already know what to do, right? Yeah. We don't go out unless we have to. We wear our face masks. And so we're anticipating that. We've definitely seen a big reduction in foot traffic. And so we've taken action in the sense of, working with our delivery partners to be able to try and get more products out there.
By doing things online, like pre-online sales for Sup Shack, pre-booking appointments down the line for reservations and things like that. It does help, and people are, for the most part, pretty understanding.
Both DeLeon and RC remain hopeful and know it all comes down to just doing their due diligence.
Just trying to find the balance of being able to socialize but still be careful. So it's a struggle, and we're still trying to find that balance. And like we got sick, regardless of us being careful.
I know it's frustrating, especially as a business owner, what's going on with the island. But I guess all I can say is just be patient. This thing, Guam has always been a resilient island, so I'm sure we're going to bounce back from this. So just be patient. Be patient. Do your part of the job. Do your part of the diligence. If you get tested, stay home, quarantine, put it out there. It's not just for you we're trying to look after. We're trying to look after everybody else's family.
Reporting for Guam's News Network, I'm Jonah Charfris.
We bring in Nestor Lecanto for our next report as a U.S. Missile Defense Agency team is on island scouting for multiple locations for a massive new missile defense system, which will be used to protect Guam and its military assets from potential attacks.
What we're looking towards this Missile Defense Agency system is a more comprehensive integrated air and missile defense system that would cover the entire island 360 degrees. Now, the actual system that would be installed hasn't been decided upon yet. There's a couple of different technologies that are being looked at, and it may be one or the other or a combination of the two.
The Admiral says for several years now, the Indo-Pacific Command has identified the need to bolster Guam's missile defenses. The game changer was a $270 million appropriation from Congress to the MDA late last year. It provides the initial funding for what we now know will be a massive new project.
Because the new system will defend the entire island and reach out to other parts of the region as well, too, it's going to actually have parts and pieces in multiple locations. And so what we're really focused on with the Missile Defense Agency as they're here is looking at the existing Department of Defense lands and seeing, can we make all of the parts and pieces needed to make the system work fit on the lands that DoD currently has in possession.
One of those parcels is Eagles Field in Mangilao, which has been Governor Leon Guerrero's first choice for a new hospital complex. It's now one of many other military-owned properties previously targeted for potential return that will be affected.
Some of the lands that maybe last year were listed as excess probably won't be listed as excess anymore, just to give us the time for the Missile Defense Agency to do what they need to do to figure out, would we need this particular plot of land or not for the defense system.
For Guam's News Network, I'm Nestor Lecanto.
Let's get now to that federal lawsuit by Earthjustice and Prutehi Lutekson against the U.S. Air Force, because the former are implying that the latter may have allegedly failed to comply with environmental policies with its plans for open burning and open detonation in northern Guam, and the site highlights just how dangerous the practice may be.
The Air Force is moving ahead with seeking permission to literally blow up bombs on the beach of northern Guam without looking at safer alternatives, ways to dispose of munitions without blowing them up in the open on ancestral lands.
Earthjustice and Prutehi Lutekson seeking a legal remedy after the U.S. Air Force submitted an application to renew its hazardous waste permit for open burning, open detonation at Taragi Beach at Andersen Air Force Base. They say the Air Force failed to take a hard look at environmental impacts, violating the National Environmental Policy Act.
If you look across, the United States at various communities where open burn is happening by the U.S. military, there are extremely high rates of particular forms of illness, cancers, all kinds of environmental issues. There's issues of water contamination, soil contamination. There are towns that basically have to have their water tested on a very regular basis because the contamination is so high.
It's an issue with global reach. In a U.S. Special Inspector General report assessing open burn pits by the U.S. military in Afghanistan, it was found that military and civilians were put at further risk from the potentially harmful emissions.
It's really unfortunate that the same attention hasn't been paid to open burning and open detonation domestically. It's not just something that happens during wartime in another country. It happens in everyone's backyards, right? It's happening on the beach on the northern coast in Guam. And while open burning hasn't occurred for a couple decades or so, open detonation still very much is happening.
The Special Inspector General for Afghanistan Reconstruction report notes DoD communication, writing that burn pits should be a short-term contingency when there's no alternative. The Obama administration launched a registry in 2014 to better understand the impacts of exposure to airborne hazards during military service. In 2019, Trump signed into law legislation that would phase out the use of burn pits. Earth Justice says the big question is why the wartime practice is planned for Guam.
Why are you doing this? What are the impacts? And what are the better ways that you could do this without causing harm to, the environment and the people of Guam?
The law is not new, but if plans move forward, the effects could be irreversible.
This application for the permit is not a new application. It's a renewal application by the Air Force, and they've been making these applications to the Guam EPA over several years. And I think an important thing to remember is science changes and it innovates and it improves on methods that are going to be really geared to take care of our environment. And I think it's important that the Air Force has to answer to this, and it would be their burden to show through an environmental study, through an environmental assessment, what those alternatives are. It's not our burden to say that. It's not our burden to say that.
In regional headlines, the CNMI has reached a 98.7% vaccination rate, but the front line for our friends up in the north is beefing up their efforts and prepares to have more COVID treatment available throughout the Marianas.
The CNMI has a growing arsenal of COVID-19 treatment in its battle against the virus.
We are pretty much, well stocked, and we have currently about 10 different kinds of therapeutics for treatment and even for pre-exposure prophylaxis for COVID.
Still in its first surge, double-digit daily case reports throwing the total case count to over 4,000. There are 435 active cases and 6 hospitalizations.
For Region Cove, we have, I think, for all the sites that we have, about 700 has been given for Region Cove. That's the main map that we are administering. One, because it's it's still effective for Delta, and it is being administered subcutaneously, 4 sub-Q shots.
Omicron hasn't been detected in the CNMI just yet.
It's not been confirmed yet, so we have Sotrovimab. Just in case that will be confirmed in CNMI, we will shift to administering Sotrovimab, which is an IV infusion, one-time IV infusion.
She says if you're in the NMI and you test positive for COVID, the first thing you should do is call the COVID hotline. The treatment is available across the NMI hospital clinics. She says the pharmacy reports how much treatment is left on a daily basis.
It's an additional task, but it's something that is needed. And it's good that we can all help each other to cover what is needs to be done.
And thank you, as always, to our friends over at Pacific Points for bringing you the Link Headlines updates every single day. And, of course, we thank our friends at First Hawaiian Bank for bringing you tomorrow news headlines with Uncle Keen Concepcion.
Buenos tanapades to get some to be tuned tomorrow ni KUAM News. Presentan ni Familian Mizo gi First Hawaiian Bank. Iotenta na Ruben Pedras Paxlovid sa matumagi estagi isla gimapos sa semana. Desta mama distribute gati Guam Memorial na Hospital sa ni Guam Regional Medical City na hospital. Spokesperson pa Guam Memorial na Hospital si Mai Habib ha confirma na maresibi pati niya lo asangan na trabia timan mananay prescription para este na amon. Ilingan este na amon sa nisitay for matnay na concern pharmacist laboratorian baseline sa masenpulan ni izo ni malango na medical insurance. Asangan lo kay na Guam Memorial sa mafatututui dupot siya reglamento para este na amon. Pago GRMC CDC sa paro mananalo tati maresibe na Paxlovid gin ni Departamento ng Salud Publiko. Spokesperson B si Cindy Hanson asangan natazad sa niya GRMC Clinic Outpatient para sa Vision General Healthcare di sinya manay estinaamo di publiko. Masasunto, Guam Education Board sa mabota todo ni membro niya para may lihi de nuevo si Mark Mendiola dan si Dr. Mary Okada para chair and vice chairperson dito niya board meeting ni masusesa di kada mes gi ipahingi. Minat ka estime na chess biyahe na may lihi si Mendiola sa segundo biyahe para si Okada. Dumanya dos para manayad masudangkulo na agradecimiento para i-board ni Masedi siya para matsogitaro este gi mamayla na term. Ilaing guaan sa orde ni board na maazik official niya i-permit na meeting niya gi Enero na mes kadasakan. YouTube na sunto gi pinut sa moro para pago na Webes gin ni KUAM News. Iguang Community College na estudyante siya sa mamanay lugar para maadsik kofanhano para eskwela para matsogya remote learning bago na semester. Segundo Director Communications and Promotions si John De La Rosa asangan na para maadsik ni estudyante sa tipo di kausang COVID gi campus eskwela. Lanya na pwede kinahuli kausang COVID gi isla para fan manay oportunidad at si post-secondary na estudyante siya para makontinue ay class entry internet. No like na loki na sina maadsik ni estudyante isang ginamalago fan matugat gi GCC. Manay oportunidad para fan manungo online para 2 semana de tempo desde este mamayla na lunes. Lo siempre may evaluate hinanaw niya sa maregla como necesaryo. Para Guam News Network, Gualsican Conception. Yasuto ifinut sa moro sa presenta sa ninafato ni Familia Mizo gi First Hawaiian Bank.
Say hello to the First Hawaiian Bank mobile app, where you get smart insights into your finances so you can make smart decisions with your money. With a daily personalized feed, you can compare your monthly income to spending. That's better. Discover where your money is actually going. You might be surprised. See what's essential and what isn't. The more you use the app, the smarter it gets. With insights from the First Hawaiian Bank mobile app, it all starts with yes.
Do you feel like you're missing out on something? Make life more rewarding with Pacific Points. Earn and redeem points for bill rebates and free load at IT&E, discounts on fuel at Shell, vouchers at Foodies, and United Mileage Plus miles. You can even pay with Pacific Points at IT&E, Shell, and Foodies. Pacific Points. Do more, get more.
Taco Bell is so good and so cheap.
I know, right? I wonder why.
What if they know we're broke? What if they're trying to be the good guys?
Yeah. Thanks, Taco Bell!
Mariana's Irrigation and Landscape Superstore. Stop on by and visit our showroom today. We offer everyday low prices on all major outdoor power equipment like bush cutter, chainsaw, power washer, generators, and more. Need service, repair, maintenance? Well, check out Guam's best superstore only at Mariana's Irrigation and Landscape, located in Barragata along Army Drive between Submarina and Besta Market. Call 735-7446 for more information. Now shipping to surrounding islands. Mariana's Irrigation and Landscape Superstore.
Get the job done the right way by getting the right stuff at East West Rental Center. With years of experience helping builders, we definitely got what you need. Call 646-1463 or visit us in Upper Tumon. Open Monday to Saturday from 7 a.m. to 5 p.m. and on Sundays from 8 a.m. to 5 p.m.
Pizza Hut stuffed crust is the crust that made crust good. Topped and stuffed with over a half pound of cheese. What are you so afraid of? Loving it? Original stuffed crust, only from Pizza Hut. No one out-pizzas the Hut.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Join Nestor Lacanto for virtual in-depth discussions with the movers and shakers in our community every Wednesday on In Full Zoom. Presented by IT&E and Calvo Enterprises, Inc. KUAM Communication is your go-to source for the biggest national and international sports events. Check out KUAM TV8 and KUAM TV11 for the biggest sports specials, championships, and events from every court, track, field, and playing ground. We're bringing you all the action and excitement. Brought to you locally by Mariana's Irrigation and Landscape and Docomo Pacific.
Buenas, Sanhafadi. Part of taking care of yourself is participating in cancer screening.
Make it a point to see your doctor at least once a year for an annual visit to discuss your risk and to determine which tests are right for you. Many tests are free or covered by insurance, and there may be programs to help those who don't have insurance. Cancer screening can save your life. There are screening tests that can catch cancer early when it may be easier to treat. So learn more at cancer.org/getscreened.
Hey, we had a question. Good morning, by the way. Morning, Bree. What are you looking at over there? You're playing catch up, huh?
Yeah.
What was that? The DOA thing?
DOA thing?
Yeah.
Oh, there's a new circular related to mandatory vaccinations for GovGuam employees. So I guess they revised it, and it's. Let me pull it up. Thank you for putting me on the spot.
Sorry, yeah, you got it. Hey, welcome back.
Yeah.
It's
an
8:31.
organizational circular requirement of Government of Guam executive branch workers to vaccinate against COVID-19 guidance. Technical update number 2. There's a major change to requests for exemptions based on medical reasons, and so just the quick read of it looks like you don't have to go to public health if you're a GovGuam employee and you want an exemption from the vaccination. It now goes through, I believe, your supervisor.
Oh.
And they can approve those exemptions.
That's good because
There's probably some other stuff in here, but I haven't had a chance to fully go through it.
Thank you. And yeah, it was. I don't know if they ever approved any of those because we had always heard that it was stuck at the AG or something. So that does kind of seem to simplify it. 8:32. Senator Joanne Brown's coming up. Oh man. We got a couple of interviews on the way here. Lieutenant Governor Arnold Palacios. Have you been kind of following, Bree, a little bit everything that's been going on in the NMI? They announced their historic announcement of the Democrat gubernatorial ticket.
Yeah, I saw that.
It was Representative Tina Sablan and then Representative Layla Staffler out of Tinian, right? First all-female team to run for governor. So we'll get the lieutenant governor, the sitting lieutenant governor, Arnold Palacios, who is campaigning against his governor, Governor Ralph Torres, coming up on the show. Bree, I don't know if you saw this here, but it looks like they're going to be doing a survey at the Guam Memorial Hospital.
Yeah, I just saw that.
Yeah.
Thank you. I guess they're going to be finding out from the rank and file how they feel about their supervisors and leaders at GMH.
Yeah, we actually obtained this. I saw it on Twitter.
Mm-hmm.
It's an informational circular for GMH employees and medical staff members coming from hospital administrator CEO Lillian Posadas. 2021 employee survey. During the coming weeks, we'll be conducting an organization-wide employee survey to get a better understanding of employee morale, satisfaction, and engagement at Guam Memorial Hospital Authority. The survey is part of our commitment to ensuring the voices of our employees are heard. We will use the survey results for 3 purposes: to recognize skilled leaders who engage their teams in a positive way, to improve our policies to make them more practical and effective, and to address problem areas that demotivate people, compromise customer satisfaction, or diminish performance. The Equal Employment Opportunity and the Communications and Marketing teams developed the survey using SurveyMonkey. The survey will be accessible electronically beginning January 26th, yesterday, until February 11th. your honesty in responding to the questions is key. We cannot affect change until we identify our weaknesses, and you are integral to that journey. The survey is anonymous. Once the survey period closes, the compiled data will be shared with all staff so you can see for yourself how we're doing in the months that follow the survey. Management will meet with relevant parties to discuss plans to improve culture, performance, and address any problem areas. The goal is for the entire organization to participate in the survey so that insight can drive meaningful change. With just 5 to 10 minutes of your time, you can help make GMHA an even better place to work. So yeah, heads up, my GMH employee family, because we did talk about in this oversight hearing of the Guam Memorial Hospital how all these above-step recruitments they're doing over at the hospital affect morale. And I know some of the employees have been itching for a chance to express that, and this looks like it's it. 8:35, Senator Joanne Brown. We're going to start before she gets in. We're going to play this little clip here from session. I believe this is on Tuesday, and Senator Joanne Brown is talking about the war claims, Bree. And there were, I don't know what the status is now with the bill because there was just like a million amendments, but we will find out from the senator. But it's kind of that argument about paying the war claims out. Do we use our own money from the general fund or the Section 30 federal fund? And so Senator Brown was kind of arguing the point that we shouldn't be using the local money because it kind of defeats the intent and the purpose of the whole war claims thing. But we're going to play this clip here, and then we're going to go in with Senator Brown. Oh, is that in the new one, Jay? Hold on. Good morning, by the way. We're brought to you by Pacific Points, Cabo Enterprises, IT&E, and Jack in the Box. Where's that, Jay?
The 27th?
Session side. Yeah. Got it. Okay, thank you. So Senator Joanne Brown, right here on the link.
Thank you very much, Madam Chair. I'm in agreement probably with most of this amendment, but I do have one major disagreement, and that's with the word may. As I mentioned in my previous comments earlier today, I'm very much of the opinion that with regards to these funds going to pay our remaining war survivors, that should come from a federal source, and that specifically at this point, and as was determined by Congress previously, that it should come from the Section 30 funds, because at least that is coming from federal sources in terms of the money that's reimbursed back to Guam for the military personnel that have been assigned to the island. I think that's critical. Otherwise, we are simply, as I mentioned earlier, literally having the victims on Guam pay for their own compensation out of their own funds. You know, this whole idea of taking the drop of water that we may call the Section 30 fund and putting it into the pond of water that we call the general fund and say, oh, well, you know, it's all together. I don't think so. I think as this amendment outlines a specific source of how and when and while, and the governor's going to report and all those wonderful things. But if we don't identify that shall come from the general fund, I think it doesn't follow through with what is an expectation, even though it's a lowered expectation than others that have been compensated by the federal government with regards to injuries and atrocities suffered during World War II. And I think, colleagues, with all the challenges that our people are currently experiencing, I mean, we have a responsibility here in the legislature to be the trust of the public purse, to ensure that we are properly spending the funds of our people. And I think we need to distinguish between the monies that we identify as general fund revenues versus the federal money of Section 30. I mean, right now we simply cannot, and the concerns are there, even provide adequate education for our children. We already see those issues coming up right now. I mean, just even because of this pandemic, we can't even have consistent teaching in the classroom to ensure that our children are properly learning. And we're now going on year 3. We cannot ensure, and even though, you know, the governor made a big pronouncement last week about increasing the compensation to law enforcement, it's unfortunate because it's across the board, which still puts the Guam police at the bottom of that list. But we can't ensure the personal safety of our people. Our people put bars on their houses, put cameras out on their houses, put fences around their houses to protect themselves because they can't even feel safe in their own community now. We can't even ensure that, you know, we're going to go into our supermarkets and even have a consistent supply of food for our people right now. We can't even do that with the general fund money. And we just can't turn a blind eye to those realities because even though we say excess, we cannot even fund these things now. So I think it's critical that we distinguish between what is the general fund revenues that we have and the federal funding, which is where this money should come from. Because what are you going to do? Are we going to turn a blind eye? Look away? Or even now earlier, let's close our ears and not hear the concerns of our people out in our community? We have a responsibility to ensure how the public funds are spent, and I think it's critical that we carefully and very clearly distinguish how the public funds are spent. We shouldn't think of ourselves as elite here in the Guam legislature and not be aware of the challenges that are facing our people out there, because we can't fund these demands and needs of our people right now. We'd like to say it, it's an election year, and boy, don't we want to go out there and tell them all the great things that we're giving them. Certainly the administration's doing a wonderful job at that. I can't imagine what more we're going to hear in the next few months leading up to the election. But this particular issue demands that our people be compensated from a federal source. Otherwise, we cannot say we are giving them public acknowledgement and proper recognition. Because we cannot put ourselves up on the pedestal thinking that we somehow are in our position to do that. This is an obligation of the federal government. Unfortunately, after much effort from many of our congressional representatives, we've not been able to get it at a level of where it should be. Because our people are getting less than anyone else that's since been compensated by the U.S. federal government. And we know who they are. And yet we're settling because what choice do we have but for us to further subjugate our people by having these funds come from the general fund and not from Section 30. I object. I think we must change the language from may to shall come from the general fund, from Section 30, not from the general fund, but specifically from Section 30 monies. And then I can actually vote for this bill. I think it's an acknowledgement that's necessary. Thank you, Madam Chair, for the opportunity to comment on this amendment.
Thank you, Senator Brown.
Comment on this amendment.
Thank you, Senator Brown.
Thank you, Senator Brown. And now we got Senator Brown live here in our KUAM Link Zoom room. Good morning, Senator.
Half a day. Good morning. Good morning to both Sabrina and Chris. How are you? It's good to see you again, Sabrina.
Thanks. Good to see you too.
Hope you're a little rested and rejuvenated for another year.
Oof. Oh no, it's gonna be a big year.
Yeah, it's huge. There's an election this year, by the way.
Yep.
Oh my, already? How did that happen?
Yeah.
Good morning. My goodness. Oh boy. It's going to be an interesting year. I don't know how it'll turn out, but it'll be an interesting year.
Yeah, I'm excited. Senator, can you just start? What is the status of that amendment you were speaking to? I know that you were trying to make the amendment, or was the amendment was so that the money shall come from Section 30, and then there was the word may in there, which kind of left it a little bit open. So did the amendment pass
right.
or fail?
And certainly we pushed, Senator Frank Blas and I were pushing to have the word may change to shall. Of course, you know, they're going to look, as they did with the original action that happened with Congress, you know, the government of Guam fronted the funds so that they could begin the process of the payouts. And we pretty much wanted to mirror that process as well, even though recognizing, you know, we're not all happy that Section 30 money was being used as a funding source to pay for war reparations, but that's, you know, this is where we're at. And I very much wanted to see us replicate as close as we could to that process, because I'm very much of the opinion that that compensation should be directly connected to a federal source. And right now that source is Section 30. So that had been our hope in wanting to move that amendment forward. And unfortunately it failed yesterday. The language still says may, which leaves that up to the administration. You know, they may use it, but then again, they may not. So I'm hoping that when we do address the budget for the upcoming fiscal year, that language is put in there very specifically to make sure that that reimbursement comes from Section 30 money, so that there's a direct federal connection to what I see. You know, people talk about recognition, justice, acknowledgement of the suffering of our people. But, you know, I just in my mind have a very difficult time trying to settle here the whole idea that those of our people that were victimized during the war are now expected to pay their own reparations. I mean, that's unheard of. That just boggles my mind to try to understand that that is the logic that we're putting in place. And while some may say, well, it's symbolic, you know, it's all in the same pot. I think symbolism in this particular case is very important, because I'll tell you, if I go back, I was calculating the years last night, 33 years since I served as executive director of the Guam War Reparations Commission when I was appointed by Governor Atta to staff the commission. And the public members, the war survivors that were on that commission was the late Beatrice Emsley, the late Tunpi Cruz, and the late former mayor of Jonia, Vicente Bernardo. And I had the opportunity to learn, to work from them, to staff them, to accompany them to Washington, D.C., to testify before the U.S. Congress, to bring their story and what they went through, what our people went through. They represented our people in the halls of Congress. And they worked so hard, as many have, in paving the way of this issue, all the way back to Congressman Wampat. And to simply just look at it at this point that, we need to pay it, let's just pay it, and it doesn't matter where it comes from, we'll just pay it. It doesn't address the issue of reparations in terms of what that actually means and what ultimately it should mean for our people. So I have a very different perspective because I've had an upfront dealing with members of our community, including my own family. I mean, my grandfather is the only surviving grandparent I grew up with because my grandmother died a few years after World War II. And I know many family members of all of us that are descendants of those that were here during the war. We grew up with this understanding and this concern. Also, the fact that our people were never properly compensated and recognized for what they went through. And our families were devastated. I mean, my grandfather, had his family, he was in his early 40s. He lived in Agana, not too far from the governor's palace. And literally, as many of our people, their homes were destroyed and they had to start their lives again. Many of the families from Agana moved up to Senahanya, as those in Sumay moved to Santa Rita. And they literally had to start from nothing. So I think we all recognize that. We all have a very, emotional connection to that issue. So to me, like I said, it boggles my mind that we would not want to make an effort to, even though it's not exactly ideally what we wanted, to make that connection so that recognition and that compensation comes from federal hands.
Yeah. Senator, so where is this idea that our general fund is in such great shape that we can take $25 million for the LEAP, that we can, fund these war claims on the... am I missing something?
I'm missing it with you, Chris and Sabrina. I'm missing it too because I've been in government many years. This is not my first rodeo at the Guam legislature. I was, first a senator 28 years ago, and we've been through hard times. I know what it is, and the challenge is sometimes in a single fiscal year, sometimes readdressing the budget 2 or 3 times to try to get through that fiscal year and cover our main obligations to our people. And this idea, it's kind of ironic because, yes, we are going through this pandemic that I know none of us, we even imagined that we would ever be experiencing this, and what a hardship it is. The loss of jobs, the impact to our local economy, knowing, and we know, we will not survive if we were simply just dependent on our own ability to generate funds right now. But this idea that we take this circumstance, this unfortunate circumstance, and make it look like a financial windfall and act and spend accordingly, when, as they say, all that goes up will come down. And there's going to come a time when the revenues from the federal government are not going to be flowing through the island as they are right now. And I don't think we're planning or preparing for that reality very well. The appropriations, even the EITC money, when there's, we're going to get reimbursed for EITC. The amount of bills that were introduced to expend that far exceed the amount that's even there. And even up till, recently, we still don't hear about where and when, if at all, this EITC money is going to be, transferred to the government of Guam. But we're very quick, members of the legislature are very quick to want to appropriate left and right without any preparation of the reality that's coming. And right now, even our private sector, a large portion of our private sector is very dependent upon the actions that we take now through grants and other types of funding, the LEAP funding, to be able to helpfully bridge over this challenging time so that they can, hopefully keep their businesses operating, keep their people employed. And I just think there's a whole layer in our leadership that is not really coming to terms with that reality and planning accordingly. And you're seeing it. You're seeing constant appropriation for things that, in most days we would say, hey, that's not a critical need. But, politically we want to play that game, and it will be at the expense. There's no free ride. It'll be at the expense of our people ultimately, because we've not made the best of decisions during this time with how we spend their money.
But Senator, it's an election year.
Yeah, but you know what, Chris? Election year, comes every other year. Every other year there's an election year. And, we're not guardians of the galaxy, okay? Let's not even consider ourselves in that.
Wait a minute.
ranking,
Wait a
right?
minute. You like Guardians of
We're
the
not
Galaxy?
the Guardians of the Galaxy.
You just got way
okay?
cooler in my book.
We're not even Rocket. Rocket's pretty smart. And we're not gonna resolve the pandemic. But one thing, we do have a responsibility to do in our respective jobs is we're supposed to be the guardians of the public purse. We're supposed to ensure the responsible expenditure of public money. That's one responsibility and authority that we do have. And we should be doing it. And unfortunately, I'm not seeing that. I think, I certainly will continue to, with my one vote, continue to be conscientious of that and responsible with regards to what we are authorizing in terms of expenditure. And right now, you see the administration coming up with their own agenda. I mean, it's government all alone up at Avaloop. They're not. We're really hearing through press releases. Oh, I talked to Senator so and so, St. Augustine, and we're gonna increase the obligation of the people of Guam by $16 million. No one's going to argue the importance of law enforcement. Like, no one's going to argue the need for teachers. No one's going to argue the need, especially during this time, for nurses and doctors and other medical personnel that are there to help our people. But, can we afford it all? And are we making promises that ultimately we're going to not be able to deliver on, or we're going to start cutting positions in the government of Guam because we can't make enough money to meet payroll? And we've seen those days. Since the time of Joe Ada and Frank Blas's administration. Everything in between has been a juggling act financially, because we never generated that kind of money to say, oh, we're exceeding revenue projections. And you hear that often, oh, 60 million. 60 million, I'm sure, can be eaten up very quickly in our public health system and our educational system in trying to provide our children with an adequate education, which we can't do now. Just even getting our kids consistently in the classroom and getting them properly educated. Our people, I mean, my goodness, we have to think, how much more can we imprison ourselves in our home with bars and, cameras and fences and alarm systems because we don't feel safe in our own homes. I mean, how many of our Manoncos, some of them who live alone, they don't feel safe in this community. What are we doing to address those issues? We can't even protect our people from being raped and murdered and abused in this community right now. But we have money for everything that we think is popular and think is going to, make us look good and feel good. And we're really doing a big disservice to this community by not being more responsible with how we're using their money. And really, it's their money.
Senator, I wanted to just a couple different issues that we've reported on. First, I wanted to get a reaction from you. We had the Admiral on relative to the Eagles Field property and, the governor's big legacy project, her purse project, to build the $1 billion healthcare complex up there at Eagles Field. It was kind of unclear how far along she was in accomplishing that goal of getting that lease or license or whatever from DOD. But when the Admiral came on, he had basically said that there's no lease, that they allowed the governor to look at the property and determine if it would be feasible to have a facility there. But at the end of the day, that property was now being looked at by the Missile Defense Agency to construct a missile defense site there. And I mean, he kind of made it sound pretty much like that's a done deal and the governor's going to have to go find somewhere else to build that $1 billion healthcare complex, which I thought was so interesting because the way this whole thing started was that was how they started. They started like, we want to build it at Eagles Field. And they were firm on that all the way. It was like cart before the horse, totally. But now the Admiral's come out, and I mean, if you listen to this story, if you read it, it pretty much seems like there's going to be a missile defense thing there.
Well, I think the whole issue of Eagle Field, and certainly, yes, I mean, the administration made very big, bold pronouncements that it was going to be there come hell or high water. It's going to be built there, and this whole huge complex was going to be included. But I think the issue of the land itself, I mean, I think that would have been a controversy that would continue to come to surface, certainly because, the view is if the military had no longer an official need for that land, that it should be part of the turnover back to the people of Guam. And certainly, the landowners and their descendants are there raising a very legitimate issue that if it's no longer being used for defense, then it should come back to our people. And rightly so, it's their land. It was taken from them. So I don't think it would have been a smooth ride anyway with regards to that, because we would have had concerns And even when we had, a public hearing with regards to the initial appropriation to set money aside for the medical, for the hospital, the medical facility, we had a number of landowners and their descendants come and protest that issue and testify before the legislature. So I don't think that would have been such a done deal with regards to even local policy concerning the construction there. And we have asked the question and brought up before, why aren't we looking at alternate sites? Because I don't necessarily believe, and it'd be nice, I mean, there's a lot of things we'd love to have, but can we afford it? And the idea of putting this huge complex and taking, behavioral health out of Tamuning and, sticking them there, and public health all of a sudden needed to be there too. And, the infrastructure itself, just to put that in place, would have been significant on top of actually building a facility to standard. And then the bigger issue is operating it and the cost to operate it. We can promise all these things, but can the people of Guam afford it? And even though we know we need a good facility, a new facility, ideally the question is, could we afford it long term? And even though, the governor is looking, well, I've got these federal monies, I'm going to take it out of here and there and we'll put it together. We can't even do that now with our hospital. Let's not kid ourselves, Chris. Just not too long ago, the hospital couldn't even get all the medications that they needed. And then when you say misuse of hiring and other things there, you got to wonder, where the priorities are. So it's good to know they're acknowledging that they're going to have to look at alternate sites, even the original location in Oka where the old hospital used to be. But I think we need to do what we can afford. We want a lot of things, and it's easy to promise. Delivering is a total different story. And again, can our people afford it? And I don't think it's necessary that all these facilities need to be adjacent to each other with that higher price.
There was also another issue, crack shot story out of the KUAM news team relative to one of your colleagues, Vice Speaker Tina Munya Barnes, and her extended absence here. We're talking about a quarter of a term, right? And, we did do that story and posted it up. And the comments, they were pretty interesting, Senator. But just on just your initial reaction, because why we'd done the story is we knew that the Vice Speaker had been gone for such a long time, but there was literally no information on how long she was gone, whether or not she was working, or when she was even going to return, right? And so we did the story. She's gone. We did get a statement that she said that she has been, like many people, working remotely. That's a quote from that statement. So just what's your reaction on, I guess, just the absence and its impact, if any, on the legislature?
Well, ultimately, I think that's something for Senator, Barnes to respond to the people in the community and her constituency. We've all gone through in varying degrees of illness within our families, and some of our members, ourselves, have had to deal with those issues. But the challenge is, we're in a public position, a little different from just our regular job that doesn't carry this public responsibility. I think, I'm hoping at some point she'll make an affirmative decision if she's able to come back, if that's her intention, or is she planning on stepping down because, her family obligations. I think we all understand that a family is, comes first. Even if we are in a public capacity, and, I understand she has a family member that is in a really critical health situation. We heard, latter part of last year, she was also involved in a serious accident. You don't wish that on anyone. But I'm sure at some point, because the absence is significantly long, she should come out and make a public determination and let us know, us as colleagues and the people, more importantly, what her plans are. Because I think it's very hard to sustain this if you plan on coming back and running again, unless she plans on, not seeking re-election. But, we do have a public obligation for the time that we're here to fulfill our responsibilities. And if we're unable to because of other pressing needs in our family, as we all, can empathize and understand, then maybe we have to make, our own decisions that if we can't fulfill our obligations, then sometimes we might need to step down or step aside. And, I don't think anyone would ever hold that against you if you're in that situation. But something at some point needs to come. To continue on this way, I don't think the public would find that acceptable, no matter what our circumstance, because we were in a position to make a decision on how we deal with it. And while we're in public life, we do have public obligations. And if we're not able to fulfill them, then we need to be upfront with the people and say, I cannot, because I have this extending obligation to my family. It's a priority, understandable. And I'm not able to fulfill my public responsibilities. And so, I can step down. And that's an option.
Yeah.
But, we are waiting. We don't hear any more than you do. I mean, we're in the Guam legislature. We hear the motions every session to excuse members that are not present. At some point, I wonder if I should raise my hand and say, can we have an explanation? Because
Where's your note?
sometimes the absence are pretty much the same members, that are not here for whatever reason. They don't let us know why they're not there. Maybe the speaker knows as the head of the body. Maybe they relay to her that they, where they're at.
Yeah.
But the rest of us don't necessarily know where our colleagues are in their absence.
I did do like kind of a cursory review of the attendance, and I noticed obviously the vice speaker has been absent since July of last year, but then also Senator Mary Torres is absent quite a bit. But there was a little thing, Senator, I wanted to ask you about because the cameras didn't catch it, but I had heard that Senator Mary Torres was like covering her ears when you were speaking at the legislature. I really tried to find the video because I heard it from actually a few of your colleagues and some other friends down at the legislature. I mean, talk about Queen Petty. That is just uncalled for.
Well, I don't know. Maybe she doesn't want to hear what I have to say. I don't know. I mean, I'm going to continue to speak out. Some people go, well, Joanne, you're very strong with what we know. But, I'm not a scripted senator. It's one of the surprises for me coming back after 14 years is how scripted the Guam legislature is. It's kind of vanilla. A lot of my colleagues have and I don't know if they spent the time to write their written statements, but it's very scripted. And I'm not of that. I mean, unless you're giving the state of whatever address, maybe that needs to be written. But, I speak from the heart. I speak from my mind, what I think and what I have in a position. And I've had many years of experience with oratory. So, it's a losing art that we have now because not everyone who is in the legislature has the ability to get up and articulate what they have to say. Some of them are very dependent on their computers and who's typing their response at the other end in some cases, or, their pre-scripted statements that they read out. I mean, even introducing a bill or closing on a bill, it's written out. And maybe they need to do it to put all their thoughts together. But I kind of like people that look me in the eye and say what they got to say. That to me has a little more value. At least I'm feeling it's a more genuine presentation. So for me, with regards to speaking on the war reparations issue, I'm passionate about it because I have some direct firsthand experience. I have many people that I sat down and helped fill in their applications for compensation that have since passed away. People, elderly that otherwise would never come down to the governor's office. And many of them have passed. I've been to the funerals of every single one of my, public members on the Guam War Reparations Commission and have been to their funerals, knowing that this issue was never resolved before their time. In my own family, and in my family's experience and what I've learned and what I've heard from my grandfather. So it's very personal to me. And I don't think you can speak of these issues and not have some concern and some heart because of what our people went through. So, if I'm a little too passionate for some, I'm not going to fit everybody's cup of tea, but I'm going to be able to express what it is that I feel and what it is that I think and what it is that I feel I need to say while I'm there.
Yeah, well, you got to be passionate if you're working for the people. So
I would hope so, because I'm really not here just to take up space. I mean, I was a senator when I was in my 20s, and I had fortunately a lot of good people that that I had an opportunity to work with who were very experienced. People like Joe T. St. Augustine, Tony Mpinko, who I have tremendous respect for. Speaker Mpinko was the guiding light for many of us. He helped orientate us, many of us young senators that, years later, I still learn and appreciate everyting that he provided.
Yeah. Let me tell you a story.
John Uggan, these are people that I had the opportunity to, and even Ted Nelson, who's quite a talker. But you learn. I had the opportunity to learn from him. I could not ever, nobody could ever out-talk Ted Nelson. Sometimes people like now, if you go to committee of the whole, we're kind of raising concern about the very limited restrictions that this legislature has put in place with regards to asking questions and commenting, because you can only speak or ask questions for 5 minutes, 3 rounds, and that's it. And then you can't get back on the floor and comment on the bill. Very restrictive. But the original reason the 15-minute rule was put in is because of Ted Nelson. Because he could go on and on and on. So,
Ted Buster.
But it's all a learning experience. And I was very fortunate. Governor Atta gave me such a tremendous start in my government career that, now we, 30 years in hindsight, looking back, I'm very blessed to have had those opportunities. So, I'm fortunate in that.
Yeah. I went to lunch one time with the late speaker, Tony Mpinko, and we had eaten. It was a Vietnamese type place. And so
sure.
he ordered the pork chops. But the thing that got me was when he ordered the pork chops, he said, "Oh, can you cook it medium?" And when the waitress went away, I was like, man, Speaker, you eat your pork chops cooked medium? And he was like, no, boy, they always overcook it. So that's the nice way of telling them. So,
But you know, Speaker was a connoisseur. If you want to know where the best restaurants were, you know, Vietnamese, whatever.
Yeah.
Tony and Pinko knew. He knew where to go, you know, and those are all good memories, I'll tell you. I miss him. You know, it's hard to believe it's 14 years. This year, I believe, will be the 15th year since he passed away. But, you know, it's a kind of legacy that they leave behind, and the experiences and the opportunities that they provide for you and the learning lessons that they provide for you. And he was a very good influence in me, certainly in running for office. And many of us, and even those that have gone on to be governor, you know, that he's planted a seed with. So I think that's something we got to appreciate, hopefully pass on for the hopeful up and coming. I hope that we are going to have a new generation to come and take on so that, you know, the rest of us can retire and move on to other things.
Senator, thank you for your time. It's always great to have you on.
Senator Brown.
Good to have you. Good to Sabrina. You guys take care. And I'm hoping for a better year. Let's hope and look forward to that.
Hey, you know, no expectations, no disappointments.
You're kind of jaded. Huh?
Sorry. It's okay. Bye, Senator. Jaded. Nah. Okay, yeah. 906. You guys ready? You got your passport? What do you need to go to CNMI, Tomas?
You need a mandatory health declaration form, your passport, and you're gonna get swabbed twice when you land. So.
Do I need a negative COVID test?
No. Hopefully it's negative when you get tested
Okay,
when you land. So.
Yeah, so we're going in with Lieutenant Governor Arnold Palacios. Okay. Good morning. That's coming up next, 906. We're back with more of The Link. Good morning.
The relationship between Guam and...
Mariana's Irrigation and Landscape Superstore. Stop on by and visit our showroom today. We offer everyday low prices on all major outdoor power equipment like bush cutter, chainsaw, power washer, generators, and more. Need service, repair, maintenance? Well, check out Guam's best superstore only at Mariana's Irrigation and Landscape, located in Barragata along Army Drive between Submarina and Besta Market. Call 735-7446 for more information. Now shipping to surrounding islands. Mariana's Irrigation and Landscape Superstore.
Pizza Hut stuffed crust is the crust that made crust good. Topped and stuffed with over a half pound of cheese. What are you so afraid of? Loving it? Original stuffed crust, only from Pizza Hut. No one out-pizzas the Hut.
Get the job done the right way by getting the right stuff at East West Rental Center. With years of experience helping builders, we definitely got what you need. Call 646-1463 or visit us in Upper Tumon. Open Monday to Saturday from 7 a.m. to 5 p.m. and on Sundays from 8 a.m. to 5 p.m.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Do you feel like you're missing out on something? Make life more rewarding with Pacific Points. Earn and redeem points for bill rebates and free load at IT&E, discounts on fuel at Shell, vouchers at Foodies, and United Mileage Plus miles. You can even pay with Pacific Points at IT&E, Shell, and Foodies. Pacific Points. Do more, get more.
The relationship between Guam and Manila, Philippines is undeniable as we share similar cultural traditions, history, and heritage. With generations of Filipinos calling Guam home, KUAM presents a monthly look at the capital city featuring in-depth and engaging interviews on everything from medical tourism to new business and government leaders. Veteran newscaster Nestor Lecanto delivers Beyond Our Borders. This special program is brought to you by KFC and the Medical City, where patients are partners.
Join Nestor Lecanto for virtual in-depth discussions with the movers and shakers in our community every Wednesday on In Full Zoom. Presented by IT&E and Calvo Enterprises, Inc. KUAM Communication is your go-to source for the biggest national and international sports events. Check out KUAM TV8 and KUAM TV11 for the biggest sports specials, championships, and events from every court, track, field, and playing ground. We're bringing you all the action and excitement. Brought to you locally by Mariana's Irrigation and Landscape and Docomo Pacific.
The KUAM Podcast Network is back and on demand, featuring a great variety of podcasts from our island and region, including culture, lifestyle, awareness, crime, politics, commentary, comedy, and entertainment. Available on most streaming platforms. The KUAM Podcast Network. Subscribe and listen now.
See what's on TV tonight with schedules, network news and notes, local promotions and giveaways on KUAM Communications social media pages. Like and follow us on Facebook or Instagram now for all the latest and never miss out.
Uno Mixed. We're mixing it up on the last Thursday of every month with a look at lifestyle, entertainment, food, and so much more on the stations, networks, and digital platforms of KUAM Communications.
Uno Mixed is presented to you by Docomo Pacific, Better Together, and Pepsi. That's what I like.
Let us know what's up on our KOM News WhatsApp tip line at 671-727-0094. Share information about what's happening in your town, on Guam or the CNMI, and what you want us to know. Reach us on WhatsApp at 671-727-0094.
Here on Breeze 93.9 FM. Keep you on the low, don't want nobody to know where you're coming from. When I can't have it, boy, it's been too long. Want you here where you belong with me. You're my bad habit, keep you on the low, don't
Hey, we did have some comments. Welcome back, by the way, to the link. 912, Lieutenant Governor of the CNMI. LT Arnold Palacios, just right there. We did have some comments, though, kind of talking about our interview with Senator Joanne Brown. Huey comments in Tomas, how about getting some new people in office? Senator Tina Muñoz-Barnes has had a seat 7 different times. Senator Tello has been in office 3 times. In the year she didn't run, she was appointed GM of GVB. Same with Senator Talina Nelson. On top of having a military career, she still had time to be voted in 3 different times. She's usually not in. That's right. I forgot when I was talking about the most absent senators. She's one of them. She's usually not in for votes due to conflicting schedules. Senator Mary Torres was the GM of the port before becoming a career politician, managing to get a seat 4 times.
That's a great analysis there.
Yeah, thank you.
We should put
Huey.
together a roll call of
right
attendance records, I guess.
And I think what Senator Brown had said about the story we did on the vice speaker. Can we just before we'll cover that coming up.
Yeah.
Okay. With the vice speaker, we did post that on our Instagram, and there were some comments that we'll talk about. But before we get to that, let's go ahead and get to this right now. Tomas Mangloni is our regional correspondent covering all things CNMI, and he's got this next interview with the Lieutenant Governor of the CNMI, Arnold Palacios. Tomas, good morning.
Good morning. Good morning, LT. How are you doing? Thanks for joining us.
I'm good. Good morning, Thomas. Thank you for having me this morning.
Yeah, so not much has happened since we last spoke, huh?
Well, there's a lot of things that's happened, really.
Yeah, there's a lot to catch up on. So I did want to ask you first for your reaction. The governor of the CNMI, Ralph Torres, was impeached by the local House of Representatives on all 6 articles of impeachment, making history as the second governor in CNMI history to undergo impeachment from the House. What's your reaction?
Sad, but it was such a long process that the community has looked at, watched on TV, and I think the House had to make a decision, and I think people are glad that we're at this juncture where they made a decision to go ahead and impeach him based on the charges that impeachment charges that they brought forth. But my reaction is, this is this is not very good for the Commonwealth. When this is the second time in about 12 years that we've done this, and it doesn't bode well for our community and for the confidence of our people in this government. But I believe that we will get through this one way or another, and begin to rebuild our foundations, in our government foundations, and confidence in our people.
And LT, I'm sure, just to refresh people's memories, you were part of those JGO committee hearings, which ultimately led to the introduction of the House resolution for impeachment. Your words providing some of the backing for the impeachment to happen. Were you watching the impeachment proceedings?
There were times when I was, but it was very difficult to watch at some points. But I did. Whether watch it on YouTube or a refresh from clippings of the news.
Why was it difficult? Why do you say it was difficult to watch?
Well, because we were going through a investigatory process of the chief executive of our Commonwealth. Secondly, the hearing itself was very, the hearing itself was in some points were very drawn out, tactical. It was very tactical on the part of some of the witnesses' legal counsel, and going to translations and all that, and making sure that what was being asked is clear, and what was being provided as answer is very clear, and so yeah, it was a back and forth. It was a long, drawn out process to have it like that, but. I guess the House had no choice, because it was a constitutional right of these witnesses to have translators. But other than that, I think that we've gone through the process, and it is now up in the Senate, and I don't envy them.
And LT, I did want to ask you, because you were the previous Senate president during the 20th NMI Commonwealth Legislature from January 27 to January 2017 to January 2019. You served as the Senate president during the 19th Legislature, 2015 to 2017. You served 4 terms in the House. What do you hope the Senate does? We're expected to hear from Senate President Jude Hofschneider, who was also the Senate president during then when former Governor Benigno Fitial was impeached, but ultimately resigned, so the Senate impeachment trial didn't happen. But as a former senator yourself, and as a long-serving member in the public eye, you know the legislature inside and out. So what do you hope the Senate will do, and ultimately, what do you hope the Republican Party will do, given that they have the majority in the Senate?
Well, a lot of people have speculated, because there's at least 6-7 Republicans in the Senate, and a lot of people in the community have speculated that our senators are probably not gonna impeach him and or convict him of the impeachment articles. But I personally, I have all confidence that at the very least the senators would give this issue the seriousness that and the decision that it deserves. And sitting in judgment of the chief executive of your government is no easy task. It is hard to do, I would imagine. I've never been in that position, but we can only imagine that it is very difficult. And they have a difficult decision to make.
Do you think the Senate should convict Governor Torres?
Tom, I don't think that I should answer that question. I would not answer whether they should convict him. I think they should look at all. If anything, I believe that they should look at all the evidence and make the adjustment based on those evidence. Because this is a very monumental decision that they have to make and live with for the rest of their lives, whether to convict him or not. There are a lot of people that believe that he should be convicted. And of course, there are also others that believe that he's done nothing wrong. And so I will leave it up to each of these senators to search their conscience and their heart to make that decision. That is actually the constitutional obligations that was vested on them when they became senator. This is one of those responsibility that one never really anticipates will be at the table when they're as sitting senators or as sitting members of the House.
Yes, sorry, go ahead.
I don't really want to, answer your question personally. I don't think it's appropriate for me to do that, frankly. But we'll let the senators sit in judgment of the facts as presented.
And I did want to switch gears to some of the election news, given that now all three teams are slated, and there will be three teams running for the upcoming gubernatorial election. You yourself, as independent Republicans with Mayor David Apatang, of course, Governor Ralph Torres with Senator Vinny Sablan, who's the sitting senator, also will be involved in the impeachment process, and Tina Sablan, Representative Tina Sablan, and Representative Layla Staffler, a historic ticket, the first female ticket in the Commonwealth. Can we just get your reaction to that news of the Democrats' recent announcement and your comment on their top, those at the top of their ticket?
Well, I've had the opportunity to work with Congresswoman Sablan, I believe in the 16th legislature when I was a speaker, and in her capacity also as Congresswoman in the 21st and now on the 22nd. But I've had fairly good relationship with both of these candidates. I would believe that each and every one of us, all members of the different team, have. I do believe that all of us want to do what is best for the Commonwealth. We may have different approaches on how to approach things and see what's best, work towards what's best for the Commonwealth. And I can only wish all of them luck because we're going to work hard too. I know these folks will work hard too. So it's going to be not just because we have a tandem of both female running as a team, but I've been in government for quite some time, and I've served in different capacity with at least 5 governors, and I've watched our history. And this is we're certainly at a crossroads here, and there are so many so many factors, there's so many variables that we're facing today, whether it's our challenges, many challenges in our community, in our government structure, ethical, moral, whether how we respond to the challenges and the many opportunities, many opportunities that we have been provided. And Dave and I are ready to take on those challenges and make the best of the opportunities that have been provided to the Commonwealth and its people today.
And LT, I did want to ask because some interesting developments out of Rhoda, and this is something that we asked the Sablon Staffler ticket as well as Nola Hicks with the Democratic Party. We got that photo out of Rhoda of Democrats for Arnold and Dave. Obviously, welcome news to you, I would assume. But many people, wondering if there's going to be a runoff in November, but also looking at your ticket as both taking disgruntled Republicans from under who no longer want to see Torres in office, but also those who might not fully buy into the Democratic ticket move over to your side. So I guess what's your comment on that and how your ticket might ultimately receive support from both sides, it seems?
Well, first let me say this. I want to acknowledge and thank people of Rhoda, especially those families and individuals that have welcomed us over that weekend, 2 weekends ago, invited us to their homes, got families together to listen to us and just hosted us. It was tremendous. We had to shuttle between 2 or 3 homes and hosting on the same night for 3 nights. So that was difficult, really. I mean, I never thought that it would be that difficult, but whether you're a Republican or a Democrat, there's always that thought that, what is happening to our community is aligning with a party, the way to do this, or is that the only way to do it? And I think what you're seeing is, at least in Rhoda and even in Saipan, is that no, people are starting to get out of that mold of being a Republican or being a Democrat or being a Covenant member and say, we're going to make a decision based on what we believe the candidates can do for the Commonwealth. And you're seeing it manifest itself. The one in Rhoda, I've known a lot of these folks throughout my career. I've always known them to be Democrats, staunch Democrats, and then I've also known we're hosted by people that we didn't take pictures of for one reason or another that are Republicans, and they're latching on to the belief that Dave and I are fairly legitimate alternative to where we are, and party affiliation notwithstanding, they're coming on board to support something that they believe would be in the best interest of the Commonwealth. But I've known some of those folks in Rhoda who are Democrat all my life. One of them was indeed my boss when I first started in government, and I knew he was a strong Democrat, but they called us up and said, we will support you.
And LT, I did want to ask because, I'm sure you might have heard in the public comments before the vote for impeachment in the House that some people say that you shouldn't be leaving unscathed, that why is it just Torres who's being held accountable when you're there as the sitting lieutenant governor? I know you've addressed this question, but given that it's post-House impeachment, I'm not sure what the rules are in terms of impeaching a lieutenant governor, but there was one comment there that said that you too should be held accountable, just at the same standard that Torres was held, because you're in the Torres Palacios administration.
Yeah, but you don't hold people abroad responsible for everything that somebody over there does, or a brother. But that's an issue that from time to time has popped up. But look, the investigation was never about the lieutenant governor. I mean, it's simple as that. But because it's the Torres Palacios expenditures of 2015 and 2016, I wasn't there. But a lot of these charges stem from even prior to 2019 when we took office. So I would think that that's just a political folly comment for some people, and that's something that we can't really help. I mean, why should I be held responsible for the governor's charges? I didn't travel. I didn't travel with him on these charges. So, yeah, I mean that's the House articles of impeachment, and it's specifically for the governor.
LT, good morning. I just wanted to break in, and I know I understand what you're saying, but at the end of the day, I mean, you guys are a team. You ran as a team, right? So how can you? I mean,
yeah. So that I get it. It's hard to it's it's Torres Palacios, and sometimes I cringe. Sometimes I cringe, like, what did I get myself into? Well, should the team be responsible for one member's misdeeds? That's something that we should think about also. There's a lot of things that have manifested themselves in the hearings that he is the governor, and I'll be very frank with you, very, very frank with you. And maybe he can deny it, or people would react to what I'm about to say, is that there are times when I tell the governor, hey, Gov, I don't think you should do that. I think you should clear it with finance or even with the Attorney General's office. What am I going to do? Force him? I'm only the lieutenant governor, and I wouldn't blame him if I did something that is against regulation or statute. And I'm, hey, I don't expect him to be looking over my shoulder, and justice, people shouldn't expect me to be looking over his shoulder. He should have known better, and I know better. And if there's even a question, the best thing to do is go to the OPA or go to the Attorney General for guidance. He has a legal counsel at his beckon right next to him. So all these things are, whether or not the Senate would judge him and convict him is really, we're going to have to leave it to each and every member of the Senate to pass the judgment with their conscience. I'm at a loss, Chris and Tom, to answer that question, and that's the best I can tell you, is that when you put on an expenditure reimbursement, for example, that's, you're the governor. And if I was in a department and probably one of my, I'm the department head, and one of my directors try to do something like that, I was just probably, ink it. And there were instances when had to make adjustments, and where I said no, even to back to his secretary and said, I think this needs to be revised or whatnot.
Can you explain what some of those instances are? Did you have to like revise, travel requests or like, reimbursements? What are you talking about?
Reimbursements, yeah. There are times when I looked at it like, hey, you gotta make sure that there's no liquor in here. And even throughout my years in government, particularly as a member of the legislature, I was very fortunate, I guess, and that I didn't have to worry too much about that. One, it was very rare that I submit for reimbursement of anything, and I also had staff that would say, "Hey, boss, you can't do this."
Yeah, LT, I did want to ask you though. Have you spoken to Governor Torres since he was impeached?
No, unfortunately, I am. And I decided to just give him space on it, and I don't want to. But I would imagine that there's a substantial amount of stress on him, and decided to maybe I should just give him space.
All right, LT. Thanks so much for your time. Is there anything else you want to add before we let you go?
Yeah, there's a lot of things going on in our community. Election is one of them. There's impeachment. There's an impending trial in the Senate. I hope and pray, and we continue to pray for our senators. This is not an easy decision that they're going to be making. And at the same time, we're still in this world of pandemic, and I was hearing you guys talk about it. What is the protocol for Saipan, and we're still in that abnormal world as we know it. But our people have to continue to be safe. Secondly, there's, like I said, a lot of challenges in our community. We need to reset priorities, and there's also a lot more opportunities that if we do things right, we will be a better community going forward. And I know that the governor and his team have a tremendous amount of human and fiscal resources that they've put aside over the years for this run. And but Dave and I are going to try to win the heart of the people, the confidence of the people.
All right, LT. Thank you so much, and we'll be in touch, as I'm sure election season is heating up in the Sinamay.
Oh yeah, I'm pretty sure we're gonna become best friends this year.
All right, guys.
Okay,
I'll try to come visit you guys when and if I ever go to Guam in the next year or so.
We would love to. We would love to have you over, especially if you're
All
bringing
right,
Piggy
thank you so
and
much.
Ice
You
Kaki
guys
and
have
the blueberry bread.
You guys have been very courteous to me and giving me time and airtime.
Thank you, LT. Esther. Okay.
Right.
Thank you.
Yeah, I think that's going to be one of the questions that he's going to have to figure out how to answer down the campaign trail, right? Is how are you not involved? How are you not part of this? How are you not partly responsible?
I mean, at his kickoff, that was one of the first things he addressed. He almost has to go. He's almost continuing his apology tour in a way.
Yeah. So how would you answer that question?
Which question?
You're the lieutenant governor.
Right.
How are you not involved, or how do we not hold you responsible as well?
Yeah, well, it's interesting, just to bring it back a little bit, because at one point, the Arnold and Dave ticket were considering to run under the Democratic Party.
Yeah.
And so you can't help but see the Democrats who were in the investigative committee having him testify, potentially teeing him up to run under their party. But Chris, as you say, it is what it is, and now there's 3 options, and people will vote in November.
Yeah, and it's going to be really good to see. Do you guys do debates or your forums or anything? Because I would really love to see, like, you know, obviously someone like Lieutenant Governor Arnold Palacios is very seasoned, right? Very tenured, experienced politician. Then you've got or the Governor Ralph Torres, who's, you know, kind of his own way. And then you've got the historic ticket of...
Yes. Yeah, there's usually forums. Hopefully we'll get a chance to have them debate each other as well.
Nice. Okay. Tomas, just real quick, the story we did on the vice speaker?
Yes, that was a story that a lot of people weighed in on online.
Yeah.
Questioning where she is and when she'll be coming back.
Right. So did we have some of those comments?
We can pull them up right now, Chris.
Yeah,
if you
sure.
want to.
Okay, I got it. And then we're going over to Jason Solis.
3 cheers for preparedness.
Right on. Yeah. Yeah, I put a lot of people on the spot this morning. Sorry.
All right. Well, some of the comments we got here, let me just filter through so I don't read anything that's inappropriate.
Right.
Jen writes, in response to the vice speaker's absence, says it's time for her to resign. Another person writing, how nice in the private sector you end up with no pay after you exhausted all your leave. How much leave does she have? 6 months is too much. She needs to return her paycheck. This one commenter writes. Someone questioning, she still receives a salary? And another comment says, she is a responsible leader. She sent notice time after time. She's good. I agree a person's personal life isn't anyone's problem. The struggle she is going through is real. Pray for her. One person writing. And yeah, lots of people questioning how so much time has been able to pass.
Yeah, and so how it works is the senators, they don't accumulate sick leave, but what they do get is they get to get paid when they're gone. So if they go on vacation, they get paid. If they're off 6 months taking care of a family member, they get paid. And that's one of the things when we had Senator Teletaidui on talking about this whole thing, she was saying that maybe we need to institute sick leave for the senators, right? I don't know if they would get 6 months of sick leave a term or anything, but you know, she just said kind of like to hold them accountable. And
what was the official comment from her office?
Oh, I have it right here. Hold on. And so the official comment from her office via WhatsApp was, like so many, this is official comment from Vice Speaker Tina Munian Barnes' office issued through her Chief of Staff, Chirag Bajwani. Like so many, I am working remotely every day and will continue to focus on the people of Guam no matter what. It's true that I left home for a family medical emergency. It's true that I'm recovering from a serious car accident, something I wish on no one. And it's true that I would much rather be home with all of you than anywhere else in the world. I'm doing everything I can to return home to Guam as soon as I can, where I have been and continue to be a lawful resident. At present, I am working remotely on matters important to Guam like the Good Neighbor Next Door program, which would secure added affordable housing for frontliners, and I'm engaged with federal partners on issues such as transshipment and COFA renegotiations.
Wow.
So that was the official statement. But anytime it's election year, if you're a sitting senator and you're putting out a statement trying to convince people that you're a lawful resident of Guam, I mean, that's just a bad look in an election year.
Well, you know, for me, I just pray and hope that she's okay.
Yeah, me too.
So
Totally. I mean, there's a lot of issues at play.
For me, I just
yes,
want to
agree.
make sure that she's all right.
Yep.
Right.
But I say at the end of the day, I would pray for her and her family and hope that everything's okay. But also, there's an obligation to the people of Guam in this crucial time. And if you have these, I mean, the gravity of this situation is huge. Yes, please take care of your family, the noble thing to do, and everyone would understand that. I mean, I don't know if the people of Guam would be okay if you just, you know, stay off island for the rest of the term, and then there would be questions if it comes to campaign time that, all of a sudden you can campaign for re-election. So I would.
No, I agree. There's a point where she's going to need to come up and say something,
right.
And address it,
right.
Talking to the people of Guam. But I'm just saying that I hope that she, her family, you know, they're recovering. You know, they're physically, you know,
right,
medically all right.
Right. Thank you, Bree. Always a class act, Sabrina Solis Mantanani. We'll take a quick break, and Jason Solis, who's also very classy, is coming up next right here on the link. Good morning.
Get yourself.
Join Nestor Lacanto for virtual in-depth discussions with the movers and shakers in our community every Wednesday on In Full Zoom. Presented by IT&D and Calvo Enterprises, Inc. KUAM Communication is your go-to source for the biggest national and international sports events. Check out KUAM TV8 and KUAM TV11 for the biggest sports specials, championships, and events from every court, track, field, and playing ground. We're bringing you all the action and excitement. Brought to you locally by Mariana's Irrigation and Landscape and Docomo Pacific.
We know you're tired of hearing about COVID-19. Some of you are probably wondering whether this is ever going to end. However long it takes, we all have to do our part, including our children, to hold the line. You can protect yourself and your family by getting vaccinated.
And if you're already vaccinated, don't let your guard down because you can still give and get COVID-19. And if you're not vaccinated, remember that if you catch the virus, you could suffer more severe complications. At the end of the day, it's the choices we make to protect ourselves, our families, and our community that will control the spread.
We know it sounds repetitive at this point, but again, wash your hands, watch your distance, and wear your mask.
Together, we have to hold the line.
Let us know what's up on our KOM News WhatsApp tip line at 671-727-0094. Share information about what's happening in your town, on Guam or the Sinamai, and what you want us to know. Reach us on WhatsApp at 671-727-0094.
See what's on TV tonight with schedules, network news and notes, local promotions and giveaways on KUAM Communications social media pages. Like and follow us on Facebook or Instagram now for all the latest and never miss out.
Here on Breeze 93.9 FM.
All right, everybody, welcome back to The Link on a Thursday morning. It's a multimedia show. It's also a multidimensional show showing you a variety of people and places and organizations that do great things for our island. And one such organization that is definitely multidimensional is the West Care Pacific Islands group. And we are bringing on Beverly Coleman and Rosario Perez today, two ladies who are dedicated to make Guam the very best it can be by providing mental health resources for young people. So ladies, a half a day to you both, and thank you what you do for our island community.
Half a day, and thank you so much, Jason, for having us on.
All right, Rosario, good morning to you as well. Certainly this isn't just a job for any of you over there at West Care. It's truly like a calling, and especially when you deal with the very sensitive issue of making sure that young people are mentally strong, mentally healthy, mentally aware even, and everything like that. That's got to be something that, it's not just a 9 to 5 for you guys. Oops,
definitely not.
You're muted, Rosario.
It's definitely not. It's definitely not a 9 to 5 job, and that's why I think, we really hit the ground running in trying to promote and bring awareness to all our youth programs. And so we're just really excited to be able to talk about the program that Rosario and I are a part of. I think the last time we were on here, I was talking about the launch of this new program, and it's Malek Naha'ani, or Bright Futures. It's West Care's Youth Behavioral Health Program. And so we're just excited to talk about the expansion of that program. We initially started as a school-based program, and we were only focusing on 3 school sites at the time. So we were providing mental health services to students at Ukudu, BMS, and FB Leon Girl Middle School. We were able to do this under a disaster response grant from the Substance Abuse Mental Health Service Administration, or SAMHSA. But with most disaster response grants, they're usually short-lived. And so unfortunately, we weren't able to obtain additional funding to sustain that service of delivery. However, we were awarded a 5-year grant under SAMHSA, under the National Child Traumatic Stress Initiative. And so that actually allows us to expand our services to the community as a whole. So any middle school or high school age youth who's experiencing any kind of mental health challenges, they can actually reach out to our program, and we're able to provide that service. So parents and guardians can call us, social workers, healthcare providers, anybody in our community organizations, any of our partners in the community can call us and reach out if they know somebody who's in middle school or high school experiencing any of these challenges. So we're just so excited to broaden our scope.
How
of
about
services.
peers of the young people themselves, ladies? Because like I mean, I think, and like I'm no expert in child psychology, but I do know from my own experience that when you're that age of between like 11 to 17, you're going through a lot of physical changes, obviously, mental changes. There's a lot of peer pressure, but at the same time, they say children are so much wiser than we give them credit for. But at the same time, your frame of reference is so limited, and kids may be going through something they may not even be aware of something they're going through and everything like that. So how do you actually address this very particular segment of our community?
So we provide individual counseling, and Rosario is one of our clinicians. We have 3 clinicians on board, so I'm really happy to have Rosario on here. And they've also provided group counseling and psychoeducational classes with their peers. So we did a lot of outreach in those school sites at the time and really tried to recruit. Rosario was responsible for doing, a self-care series, and then we had another clinician do a self-care series at Beneventi Middle School. So really not only focusing on the individual social emotional development, but understanding that peers during that time are more important, honestly, than parents and adults. And, we're boring to these kids. So we were able to have some groups with peers small enough to where they felt comfortable enough to share.
During the first iteration of this program, before you guys began the expansion, what were some of the issues confronting our youth, and what were they saying to you guys in terms of the type of health and mental type problems they were experiencing?
That's an amazing question, Sabrina. I'm actually going to hand it over to Rosario because I'm that person in the background who does all the boring stuff, and Rosario does the direct service. So she'll be able to share a little bit on that.
I don't know about boring or in the background because
you're both rock stars in our book here. You guys are amazing. You guys are truly doing the Lord's work.
Oh, thank you. And so I guess to answer your question directly, while maintaining some level of ambiguity because we want to protect the confidentiality of the things that we discuss with our kiddos or with our students. And a lot of it obviously is COVID and the changes that it has just flung every. I think as adults, we all are doing our best to manage, and I don't even know how to measure it. We're all doing our best to manage, and to go through it as a middle schooler or as a high schooler, it's just that much more. I don't even know if amplified is the word, because it's a difficult time to be in middle school. It's so uncomfortable, even in high school. It's a roller coaster of great things and not great things, and it feels like the world is ending. But ultimately, some of the things that we've been seeing is depression and anxiety, of course, and it's a very valid and natural response because a lot of our students, in one of the workshops of the series that we had done with our students, we had, at the time, I believe the students might still be doing this, they were breaking them up by their last name. And so we did one set of workshop with a set of students and they really enjoyed it. And they were like, can you pass the message on to my best friend that you're going to see tomorrow? And so I passed that message on, and it was so heartwarming, but also it was sad at the same time because they miss connecting with each other. And so I guess my point that I'm getting at is that a lot of what COVID or any kind of mental health issue brings, or it causes so much conflict for our youth, is the lack of connectedness or feeling like we don't have the support that we need. Of course, we have our parents, we have our guardians, we have our caretakers, but it's different. And as Sabrina might have said in that, or at least the underlying point is that the peers are really, they make it through together. And so fortunately, we clinicians here, we're not that far from their age, but of course we are older than them. But I think it helps in that it's, yeah, right. But it helps in that we can relate. I think anybody can relate to them. But
okay, that's a perfect word, if I may, Rosario, because I was going to say, in addition to the science and the proven behavioral studies that you guys do, how much when you're dealing with young people do you actually promote empathy and just say well, I know you're going through something and everything like that, but what you're going through isn't unlike what maybe 10,000 other kids are going through too. So you can get through this, and you are a lot more mentally strong than you might believe and everything. So building them up and letting them realize that they're not alone, and like really generating that confidence within them.
No, and absolutely, and I agree with that. And I think even just to echo off of your point in promoting empathy is something that we want to talk about in every session, but also promoting and reminding them that they're a lot more empowered and resilient than they are. But of course, it's all about timing and where they are in their headspace, because if they're feeling like the world is ending and that everything's crappy, we're not going to sit there and be like, you can do it. We're going to level with them and be, yeah, this really sucks.
Mm-hmm.
And when they're ready, be like, okay, it's going to suck for a little bit. So what can we do to make this better?
I think that's wonderful. And do you find that, that approach maybe like 50 years ago, child psychiatrists may not have been fully on board with that approach, but these days, does that really prove to make that strong connection and really resonate with a young person?
Short answer, yes. And if I, and I'm not trying to, okay, no, I should totally hype up our program. Our program uses evidence-based, our program uses evidence-based approaches. And so the approaches that we're using, of course, we have to use our clinical judgment at some points, but we primarily focus and we stay driven by evidence-based practices like trauma-focused cognitive behavioral therapy, seeking safety. Sorry, Bev, these are the things you were going to go into. Motivational interviewing. And so yeah, short answer is yes, we find them to be very effective. It's helpful in building rapport. It makes the interactions with the youth so much more genuine and helpful, because otherwise it might not be very fruitful. But I'm just speaking out in the air.
Mm-hmm.
No, that's really good, Rosario. I think when we apply for these fundings, we really do research on the evidence-based approaches that will work, but not only for the population, but does it culturally resonate with the kids we work with being in an island in the Pacific? And so that's a lot of thought that we put into it to make sure that it's something we can take, but we can adapt it here for our kids.
Mm-hmm. Okay, and again, everybody, this is a program, as they said, it's not just the youth themselves, but it's their support system, their family structure, their church group perhaps, and their classmates, obviously, whatever organizational unit you may belong to and everything, WestCare is there for you. And I want to throw out your social media handles, because on Instagram, you guys are at westcare.pi, Westcare Pacific Islands, remember everybody, represent Pacific Islands. On Facebook, they are at Westcare Pacific Islands, all is one word, and then westcarepacificislands.org. If you would like to reach out to them, please let them know. Their number is 671-472-0218, extension 102 or 126. Ladies, I know part of the job description to work at WestCare is, you must be compassionate and you must have a genuine love for Guam and, just a tireless commitment to wanting to help people and everything like that. So, you guys are obviously, I see why you guys got the job. You guys are well qualified.
Thank you so much, Jason.
Okay. Final words and everything before we let you go and everything, just about the success of the program, or maybe where you may be headed with it going forward.
I think when we launched it gave us a real good insight into how best we could help the youth. And that's why we had this urge to expand our services outside of just being in the school, to more community-based. And then we also are putting on, I just want to announce before we get off that we are also putting on a virtual presentation. And I'll have Rosario just talk about that really quick. And it's for the community as well.
All right.
Yes, so thank you. The presentation we have, please check out our website. Under the events tab, you can find a registration link. And so the workshop we're hosting is called Taking Steps Towards a Brighter Future, Supporting Teen Mental Health, which is right up the alley of what we were discussing today. And so big shout out to Manietlu and their leadership of the collaborative grant under Manietlu, because we would not have made it possible without them. And so essentially...
we're big fans of Sam Taitano on this show, trust us. Absolutely.
Yeah.
We're big fans of Manietlu.
There you go.
Yes, for sure. So I think this topic of teens and having difficulties struggling with stressors or traumas and so on and so forth, a lot of times we can see them resorting to other things that are unhealthy or unproductive as far as coping. And so a lot of what we're going to focus on is looking at emotional triggers, how caregivers, I should say too that the audience of this workshop are parents, caregivers, grandparents, guardians. And so it's really meant for the participants to be able to recognize emotional triggers or better understand them, and also looking and understanding at the risks that are associated with the lack of a healthy and solid coping skills. But primarily the overall goal of the workshop is to reduce these healthy behaviors so that participants are equipped with knowledge of common signs of symptoms of depression, anxiety, identifying stress factors, and of course the biggest thing that we hope for participants to take away from is knowing and identifying, I'm sorry, I'm getting tangled up in my words. Essentially, it's for them to recognize what makes healthy coping skills and how we as caregivers, the community, and for our families can do better for our teens and our youth. But yeah, please check us out. We hope to see everyone there.
So that's Westcare Islands, WestcarePacificIslands.org once again. I didn't even think about that, Rosario. Grandma and grandpa, obviously they are such a huge influence in a young person's life, but because of the generational differences, they might not even be able to, again, empathize with how much if you get like Instagram love, or if people are snobbing you on Instagram and everything, how much that can affect somebody. Yeah. That's a fantastic opportunity I hope grandma and grandpa, everybody like listening and everything like that, wonderful opportunity for you as well. So Rosario, Bev, thank you so much, and always a pleasure to have you guys on the show. Come back anytime.
Thank you so much. Thank you so much, Jason.
All right, have a wonderful day. Stay safe.
You too. Thanks.
All right, good stuff, everybody. Please check out Westcare Pacific, like it, and an endless cavalcade of people who just really, really care about the island, and just provide so many opportunities for wellness.
Yep, a cavalcade of caring, Jay. Good job. Bree, good job today. Welcome back.
Thanks.
Welcome home.
Or is the jet lag starting to hit you?
A little bit.
Little bit.
Are you hungry at all?
I'm starting.
What are we gonna eat? And I'm ready.
Looks like we got our first assignment now that she's back.
It's 10:01. KUAM TV. Thank you guys. It's been great. We're gonna say bye to KUAM TV, and then play Cover Me on Facebook Live and the Bree. So KUAM TV for Bree, Jace, Joe, Sir. My name is Chris Esta. Adios.
Happy Thursday.
And we're back here with Cover Me. It's brought to you by Burger King. Try the original chicken sandwich or drive-through Mondays, where every 10th car gets a free Whopper at Burger King. Again, it is Cover Me right here on the link. Link fam, Breeze, we're out after this, okay? Take care. Be safer. Adios.
She calls me the moon. Brooks that walk across my mind. The streets that might be a vine. There's something special to me. She calls me the moon. She's extraordinary queen. She sees God even in me. There's something special to me. And when darkness claims the room, I remember when you sang me the blues. And she's shining in a melancholy blue. She calls me the moon. She wrote me her language, and we speak it on our own. Feeling close when I'm alone. Yes. She's my favorite author. She wrote me a language. Yes. Elvis claims the I remember when he sang me the blues, and she said it in a melancholy blue. She calls me the moon. Soak me in your moon glow, astro universal. Though we're apart, I can still feel your love. Soak me in your moon glow, astro universal. Though we're apart, I can still feel your love. Soak me in your moon glow, astro